मैंने से ग्रुप में डाला है जो मेरे क्वेश्चन से डॉक्टर संजय राय से, जस्ट फॉर इंफॉर्मेशन, जस्ट FYI डाला है। ओके, म्यूट कर देते हैं।
नमस्कार, हेल्थ फॉर ऑल के नए एपिसोड के साथ हम हाजिर हैं। अगले 3 घंटे तक हम आपको काफी जरूरी बातें बताने वाले हैं। बचपन से हम सुनते आए हैं कि पेट की बीमारी लगभग सभी बीमारियों की जड़ है। पेट को ठीक रखो और स्वस्थ रहो। आज हमने इसी को ध्यान में रखकर विषय चुना है। आज का टॉपिक है गैस्ट्रो, लिवर और बिलियरी डिजीज, कारण और निवारण। ये विषय चुनने का एक खास मकसद ये भी है कि ये बीमारियां लगभग हर घर में मौजूद हैं। इसलिए हमने देश भर के विशेषज्ञों को अपने डिजिटल प्लेटफॉर्म पर एकत्र किया है, जो आपकी आशंकाओं को दूर करेंगे और बताएंगे कि आपको क्या करना चाहिए और क्या नहीं। हमारा ये शो YouTube और Facebook पर लाइव देखा जा सकता है। तो हमेशा की तरह हम शो की शुरुआत करते हैं सेशन और राउंड अप वीडियो से, जिससे आपको पता चलेगा कि हम क्या क्या कर रहे हैं।
Namaskar and welcome to the 15th episode of Health4All, a weekly show on health and wellness with special focus on current topics of concern brought to you by Heal Foundation. Our first session is Yoga for Heart Health. We have with us Ms. Dibya Prakash, an accredited dietitian and nutrition counselor, a wellness therapist, deep sleep mentor.
We will discuss about the importance of heart, factors that's affecting our heart health, and the practical solution how to combat those problems.
वृक्षासन भी आपके लिए बहुत ही अच्छा है। ये आपके बॉडी में एक बैलेंस लाता है। आप जब इस आसन को करेंगे तो बैलेंस लाएगा, माइंड आपका काम होगा, क्योंकि स्ट्रेस एक बहुत ही बड़ा रीजन होता है आपके हार्ट इश्यूज के लिए। आपने देखा होगा तनाव, जब भी आपकी तनाव बढ़ जाती है, आपका ब्लड प्रेशर बढ़ जाता है, बहुत सारी चीजें इफेक्ट होती है। तो इस तरह से कामिंग इफेक्ट देता है, आपके चेस्ट को ओपन करता है, हार्ट को ओपनिंग का ये काम करता है। तड़ासना, वृक्षासना के लिए हमें क्या करना है? आपको अपने पैर पे सबसे पहले अपने आप को बैलेंस करना है और इसके लिए थोड़ी सी प्रैक्टिस लगेगी, कुछ दिनों की प्रैक्टिस लगेगी। सबसे पहले आप दाहिने पैर पे, राइट लेग पे खड़े होइए बैलेंस होकर के। लेफ्ट लेग को अपने उठाकर अपने थाइस पर आप इस बैलेंस कीजिए और अपने हाथों को उठाते हुए जोड़ करके काउंट कीजिए मन में। आप 2, 3, 4, 5। चेहरे पर अपने मुस्कान स्माइल बना के रखिए। फिर आप अपने पैर को नीचे कीजिए। फिर इसी तरह आप राइट लेग को उठाकर अपने लेफ्ट लेग के थाई पर रखिए और गहरी सांस लेते हुए हाथों को ऊपर ले जाइए। अपने आप को बैलेंस कीजिए। फिर आप अपने आप को नीचे कीजिए। आप इस काउंटिंग को बढ़ा सकते हैं अपने आप की जितनी जैसे जैसे प्रैक्टिस होगी आप इसे ज्यादा देर तक होल्ड कर सकते हैं।
We move on to the next session, which is Your Health Counter. Your Health Counter is a highly popular capsule. It is an initiative of Health4All to connect with India's top medical, nutrition, and wellness and public experts, policymakers to do a straight talk on the latest topics to get insight on disease prevention and health issues. In today's Your Health Counter, we have eminent Dr. Purushottam Lal, a pioneer in interventional cardiology. He has the unique distinction of introducing the largest number of procedures in the field of interventional cardiology for the first time in India, such as rotablator stenting, balloon, mitral valve valvuloplasty, heart hole closer, TAVI, etc. He has been listed many times in Limca Book of World Records. He has been named as the father of interventional cardiology in India by Professor Adnan Kastre from Germany, a reputed cardiologist in the world. He was awarded Padma Vibhushan and Dr. B.C. Roy National Award by the President of India, making him the most decorated cardiologist of the country. Welcome, Dr. Lal. But speaking to him is Dr. Swadeep Srivastava, the founder of Heal Foundation and Heal Health, and one of India's top health communication expert. He has been at the forefront of healthcare awareness through healthcare communication and has been instrumental in creating campaigns and platforms for healthcare improvements in India for the last 2 decades.
People in not only in Noida, in North India, but across the country and across the globe have seen a lot of pioneering work done by you, and the way you have been treating and working with your patients, particularly your motto of serving the middle and lower middle class in the country, is been phenomenal and such highly appreciated and decorated also by many awards and accolades which you have earned in your career of more than 3 decades, sir. Coming back from US, having a very, very successful practice in US, then coming back to India in Chennai, Apollo Hospital, then Apollo Hospital, Delhi, because you wanted to serve your country, progressed into becoming a chain of multi-specialty hospital, and Metro is today the name to reckon with particularly in the certain segment of the society which comprises of a majority of our population, and they need heart care the most. So you have also been instrumental in bringing that access of heart care to the people of India, sir. So what is the difference where patients should know in multiple artery diseases that angioplasty is good, or of course is the call of the medical practitioner, but what patient should know about the benefit of bypass surgery over angioplasty and benefits of angioplasty over bypass surgeries?
A lot of people now, they are quite aware of, of the procedures. Those days are gone where the people didn't have knowledge. Now everybody checks with the internet and, taking second opinion, third, which is always very good. But now my point is that we divide the treatment in four. If I see one angio where I feel that it is the best for the patient to have an angioplasty, now this is the angioplasty. And there is one group of patients which I would say the bypass is preferred. And then come the mixture. There we see the pros and cons, and fourth, of course, the medical treatment. Now, if I have a young patient and all the three arteries are blocked, and when I say young, say 40-year-old, 45, 50-year-old, I would prefer personally multiple vessel angioplasty. And if I have a patient at the age of 70, 68, and there is one group of bypass, because that's the best time for the patient to tolerate the surgery, rather than I would say the doing the angioplasty. And then come the maybe, sometime when they become 78, 80, the surgery becomes relatively difficult. So we go by each patient. And then at the same time, if I have a patient coming from, say, my village or any village, where we find a patient will not be able to come for follow-up and so forth, and we want a very, very long-term result, bypass is always better for the long-term result. The people coming from the villages sometimes cannot afford, because these days the angioplasty, when we do the multiple vessels by using road ablators and so forth, becomes more expensive than the bypasses.
During COVID, especially the Delta phase, lung function was seriously compromised in severe infective cases. This affected oxygenation and in return functioning of the heart. Should patients who have recovered from COVID get a regular periodic heart evaluation test done? You can speak on patients with and without comorbidities who are down with COVID infection.
Recently, what we did was we conducted a study in patients who are COVID recovered. Now, those patients who are actually COVID recovered, these patients we started analyzing and seeing whether their heart is actually affected when they had a normal echo function. And to our surprise, what we saw was, this was documented in the Journal of Echocardiography very recently, that those patients who are apparently absolutely healthy with a normal ejection fraction, the subclinical dysfunction in the heart had already started occurring. Now, this is something which is revealing. What a person thinks that he's COVID recovered, this person is already having an effect on the heart when there's absolutely the equation normal. This we analyzed on the basis of speckle tracking and a special kind of imaging which is called strain rate imaging. And we are following up these patients. More severe was the COVID illness, the more chances was there that the heart would be affected. So definitely, while it is affecting the lung, it is also affecting the heart simultaneously depending on the severity of the COVID. So this is very pertinent that every COVID patient who is either recovered or is in the active phase of that particular disease must have a baseline cardiac checkup. It is mandatory. And this becomes even more important, especially when a patient is symptomatic. Interestingly, one good news is that those patients who are having an effect on the heart, the recovery that is happening on follow-up of these COVID patients is much better. So definitely, heart or cardiologist's role is significant in any illness of COVID. And there are various pathophysiological mechanisms that are happening because of the direct damage, because of the indirect damage, because of the immune response that is being generated. But heart is definitely affected both in the acute illness as well as during the recovery phase, as well as in those patients who are apparently absolutely healthy. These patients still have some level of chances of having an effect on the heart.
At one hand, there is an excessive use of mobile and smartphone and digital space also affecting the health poorly. On the other hand, it has been detrimental to good health, in fact, you can say, particularly amongst the youth. On the other hand, we have got the digital technology and technology as a whole also complementing the efforts of doctors and hospitals. So, what is your view on it? How digital can be best used for complementing all the efforts of the doctors and hospitals and helping our people live a better, more informed, healthy life?
So I would say that the theme is very clear. The theme is very clear for where lifestyle and habits actually play a role in all circumstances. The question which I think we should also ask is, are the habits always bad? In the terms of, yes, everybody knows drinking in excess is bad, smoking is bad for health, food is sometimes bad, certain types of food is bad. But I think in India, what we are forgetting is that education awareness is missing. So our individuals, where technology can play a role, in our sense, and that's why the India Health Link, we started with a simple mission. Can we educate our people to be able to understand what is bad, what is good? And more importantly, in healthcare, there is no one size fits all. The correlation of these factors, let's say we can say exercise is very good. Somebody can exercise every day, all day, but again, they might not be eating good food. Maybe they have other factors. Maybe they're not even fit for exercising all day, every day, because they're not supposed to. Now, how do we correlate these factors with somebody's health is where the technology can play a role. And technology can play a role by educating people and making them aware of their own self. That mobile sometimes is wrong because everybody relates that to a social media use of mobile all the time, the screen usage. But at the same time now, because of telemedicine, because of the phone in most of the people's hand, they have access to those experts, that information that they can gain themselves. The only, again, where we are coming into picture is how can we bring them in a simple, accessible way that everybody can understand that. We are not bringing new information to individuals, but technology can play a role in that particular area, that the guidance of people to correlate what is right at the right time, at the right place. It's basically India, like the rest of the world, the non-communicable disease burden is very high. And what we believe, the most can be prevented by access to basic healthcare, education and vital information. So if nothing, what we are singularly trying to manage here through IHL Care program is we are trying to empower people with this information, with their health information, before it is too late. 3 pillars of our program, and what we call IHL Care, what the 3 pillars of our program is, it's human-centered. So we build the system around people, and what we are giving them first-time access to what we call health account. But more importantly, what's missing in India right now is that the accessibility to capture that 95% of vitals, which are crucial to your health in the ease of your own comfort. Whether you are working in a company, you go to a cafeteria, whether you are living in a housing society, you should just go to a wellness community hall, or you are in a gram panchayat in a village, you can go to a nearby pharmacy, or wherever you are. You should be able to screen these vitals at ease and without any intervention, without any paramedic assistance. That is where we are bringing this scalable HPOD, which is one of a kind, clinically validated system, which within 3 to 5 minutes, without any assistance, can screen blood pressure, 6-lead ECG. It can do temperature, oxygen saturation, full body composition, height, weight, as well as the BMI, just a general calculation. And all that is done it's language compatible, and it's all accessible system. HPOD, which we're bringing, it's a small ATM size machine. Anybody can put it wherever they want. The entire platform is cloud managed. It's the HIPAA certified, which means the data which we are capturing, it belongs to the user, and it is secured and private from our technology itself.
People who were COVID infected were told not to exert for a period ranging from 3 to 6 months due to the involvement of the lungs and the heart. There were instances of young people unexpectedly dropping dead. You have an armed forces background. How is this issue tackled in the armed forces where physical training is sometimes regress?
First of all, we must understand that COVID-19 illness, just like any other viral illness, it affects all organs. Some are involved more, which express themselves clinically. So you get diagnosed with COVID pneumonia or COVID myocarditis or COVID thromboembolism. But it's a systemic illness. There could be a low-grade myocarditis resulting in subclinical myocardial dysfunction picked up by specialized tests like echocardiogram. These are the patients who are at risk of exercise-induced or when they go beyond their effort tolerance to develop arrhythmias, which they are vulnerable in any case. So a good marker for that is that if somebody recovers from COVID-19 or any other viral illness and suffers from profound fatigue, the definition of fatigue is feeling of being tired after minimal exertion for which person is used to otherwise. So these are the patients where one should suspect there could be a subclinical myocarditis, which makes them vulnerable to all kinds of problems, including sudden death on exertion. So these are the patients who should be investigated in a targeted manner. And if there are signs and symptoms of myocarditis, they should be given prolonged rest. And there are some medicines also, which I will not go into detail here, but they can be put on some medicines also to make them recover, particularly those who are found to have impaired heart function. Those patients who have profound fatigue or sequelae after initial illness should be investigated. All others can follow routine healthful activities like good nutrition, remaining well hydrated, etc.
Do you see the linkage of these over medication with the increasing incidence of heart disease?
Over medication related to COVID and heart disease? No. If anything, we give anticoagulants to most of our patients who have COVID, and that, if anything, can protect to some extent against heart disease. So I don't think, other than steroid, of course, steroid has so many side effects, including cardiac, which if you start a patient on steroids, then you have to monitor his blood pressure, his sugar, and by default his heart. All my patients who have, I'm a surgeon, who have had heart surgery, they are always worried should they have vaccines. Now it is imperative that a heart patient, whether operated or not, whether stented or not, should get a vaccine as per our current knowledge. So my message to your viewers, who I believe are quite, most of them are not doctors, is that yes, you must get your vaccine. Antiplatelet does not matter. Aspirin does not matter. But if you have had a heart valve surgery and you are on a blood thinner like acetylene, then you must monitor your INR, which all heart patients who've had valve surgery know. And if it is below 2.5, then you can get your vaccine without any problem. If it is more than 2.5, then better to avoid.
What are the precautions that COVID recovered people should take before hitting the gym?
What kind of precautions they should take is the first and foremost thing that I would advise them is to take approval from their cardiologist or from their doctor. In case first they have to check their blood pressure, sugar, all the other parameters should be under check before they hit the gym. Secondly, if you are hitting a gym, it is very, very important that you're guided by a qualified nutritionist and a fitness trainer. As I said, most of the time, these trainers or dietitians, if they are, especially the trainers, if they are not qualified enough and if they are giving, a lot of time it is seen that they have been giving a lot of diet advice to their patients or to their clients, which should be avoided. And once you have recovered, it is important that you get your heart rate checked, your blood pressure checked, and your diet should be a properly disciplined diet. Once you feel there is no fatigue, you're not getting tired, only then you should think of going back to the gym. Otherwise, I would advocate start with a very, very slow-paced exercises.
Should young COVID recovered IT professionals take a periodic heart evaluation test, especially TMT? And if so, how often?
Anybody who has recovered from COVID, you need to look at the heart. Because it's very rightly said that we are seeing a lot of upsurge of cardiac illness, especially in those who have been recovered from this virus. And the more severe the disease, especially those who have been through an inflammatory phase of COVID-19, the chances of having an underlying cardiac issue is also there, whether it's a thrombotic issue or whether it's a myocarditis or whether it was just they developed myocarditis during the COVID period or they developed it post-COVID sequelae or the long COVID. Yes, you need to look at the heart. So whether you're an IT professional or not, whether you're young or old, if you've had COVID, I think you should go for a cardiac evaluation. The decision of whether to go for a treadmill or not is it's again not one size fits all. I would really not recommend anyone, young or old, to take the decision of doing a stress test on your own. Meet your doctor, let him assess you, let him look at your functional capacity, and then take a decision whether you need to go for a stress test or not.
और अब वक्त है योगा सेशन का। हम योगा सेशन की ओर जाने से पहले आपको बता दें कि हमारा ये शो दुनिया भर में YouTube और Facebook पर लाइव देखा जा सकता है। अभी से 11 बजे तक ये शो लाइव रहेगा। तो अब हम आपका परिचय कराते हैं योगा एक्सपर्ट मिस महती विस्पुते से। मिस महती प्रसिद्ध योगा टीचर और थेरेपिस्ट हैं जो 10 साल से इस क्षेत्र में सक्रिय हैं। वह मैसूरू स्थित योग दर्शनम में प्रशिक्षक हैं। वह आर्ट ऑफ लिविंग संगठन में वॉलंटियर भी हैं और मेडेक्स हॉस्पिटल बेंगलुरु से जुड़ी हुई हैं, जहां वो योगा थेरेपी और आरोग्य फिजियोथेरेपी भी कराती हैं। आज गट हेल्थ पे हमसे बात करेंगी और हमें कुछ डेमो भी देंगी। मिस महती, आपका स्वागत है हमारे शो में।
जी शुक्रिया, नमस्ते।
नमस्ते। तो अब हमारे पास टाइम बहुत कम है, तो 25-30 मिनट में हम जो भी कर सकते हैं इस समय, तो प्लीज अब हम आपका ज्यादा समय नहीं लेंगे।
जी, so today we're speaking about gut health, right? In English you would have heard the phrase I have a gut feeling, gut feeling that this idea is good, something's going to go wrong, because gut is considered to be your second brain. Okay, your brain is very closely connected to your gut or your digestive system. तो मतलब सोचिए ना कि अगर आपको थोड़ा सा भी स्ट्रेस लगे, थोड़ा सा डर लगे, you feel a knot in your stomach, जैसे पेट में कुछ तो होता है, because you feeling that. Yeah, so it is very directly connected. Now think about the other way around. अगर आपका पेट खराब हो तो आप भी इमोशनली थोड़ा सा ना मूड खराब ही होता है, right? So your digestive system to be clear, to be happy is extremely important for your day. Today we're going to go through a couple of asanas. Okay, it is very important that first, if you've had an accident, if you are not well, or if you're pregnant, you should get asanas consulted by a yoga therapist or a physiotherapist. Not every asana is for everybody. Okay, so let's say I show you 10 of them. 10 asana में से अगर आपको लगता है कि आप 3-4 कर सकते हैं, आपको कोई प्रॉब्लम नहीं है कि you don't have knee pain, shoulder pain while doing it, then you should definitely do it. Go for it. Do them every single day. Yeah. So let's first start with asanas that you're doing when you're standing. Okay, standing asanas. बहुत ही सिंपल आसनास है, ओके, जो कोई भी एज का कोई भी कर सकते हैं. We'll start with those first. Okay, when you're doing for your gut health, there are 2 things you have to keep in mind. One, you're looking at your digestive system. जैसे अगर आप सोच रहे कि आपको शोल्डर के लिए एक्सरसाइज करनी है, what will you do? You'll move your shoulder. You'll take weights to strengthen your shoulder. In the same way, if you're thinking about your gut, you have to move your gut. Everything is about your gut. And secondly, what is important are your hips. If your hips are not loose enough, if they're not comfortable in movement, then you will have some sort of a gut problem. Yeah, so let's start with the first one. Hip distance between your legs and just move. Okay, rotation. Second one that you can do. Okay, hip distance. Lift one hand up. Bend to one side. Lift the other hand up. Bend to the other side. Third one that you can do. Back straight, spine straight, fold your waist, bend down. Okay. What a lot of people do is they do this. They slouch and they try to reach. Now that is not good. Okay. Your spine needs to be straight. Hold your back, hold your waist, and bend down. 45 degrees or a little more. How much ever you get. Jitna ho sakta hai utna kare. Okay. What you're doing here is you are pressing your stomach. Okay, yahan pe. So then you can come up. Support your back. Bend back. Come back straight. Very simple exercises. Yeah, from here you can move to twisting. Twist your back. Okay, these can be done by absolutely anybody of any age. These are very simple to do during your daily activities, normal lifestyle. Yeah, now we look at a slightly complicated set of asanas, which you can do. Okay. Look at the instructions correctly. Okay, we're going to start with the first one. Okay, all of these are hip opening exercises that we're going to start with. Okay, enough distance between your legs. Now, turn your one foot. You can, let's say, start with left leg, turn your left leg. 45 degrees, the right leg looking straight. Bend down. In any case, your knees should be at 90 degrees. हमेशा 90 degrees होना चाहिए. अगर आप ये कर रहे हो, तो there are more chances of injury. Okay, तो safe side के लिए हमेशा आपकी knees foot की जो line है, उसके पीछे ही होने चाहिए. So you're staying at 90 degrees. Take the support of your hand, keep it on your knee, and then lift your hand up. Okay, your leg, body, and hand. Everything is in one straight line. Same thing you will do on the other side also. 90 degrees, take support of your hand, lift your hand up in one straight line. Okay? इसमें ये नहीं होना चाहिए कि आप आगे मुड़ रहे. That is wrong. You have to be in the same plane as your legs and then look straight. Okay? From here, you can move to the next one. Turn your body. Look straight. Now, the leg behind, you keep it on your toes. Front leg, 90 degrees again. Yahan se, keep your hand on your thighs and look straight. Let your back be straight, look straight, and go down as much as you can. If you're very comfortable with this, if you can do this nicely, namaskara, lift your hand up. Okay, it is a namaskara on the top. Do this on the other side also. Come down, 90 degrees, back leg on your toes. Use your hands, sit up straight. Then, namaskara. Now, both of these exercises are for your hips. The more free your hips are, the easier it is for your vocal movements. Yeah, once you're done with these, and you can do them comfortably, you can start with a twisting asana, which is one leg forward, just like we had done some time back. Right leg forward, sit down. Now you're looking straight. Yeah, from here, you look to your side, the side that your front leg is.
यहाँ से once you've turned, use your left hand over your right leg, so left hand. Namaskara and turn. You have to stay in that position however long you can. In the start, maybe you can, do 4 counts, then move to 6 counts, move to 8 counts. Keep it at your own pace. Okay, ये नहीं होना चाहिए कि मतलब आसना करने लगे पेट दर्द हो गया. So you shouldn't allow that. Same thing on the other side. Left leg forward. Twist your body in towards the side. Use the lower hand to twist a little more. Namaskara. And you look up. Look straight. Smile on your face and stay. Now, those people who find this difficult, there's another way of doing this. Okay? You can move to the next one. Wherein sit down like it's a chair. Sit. Okay? Stay for some time. You have to get comfortable with this. Lift your hand up. Stay. Do this for a couple of days. Once you're comfortable with that, sit down, hand up. From here, like we just done, use your lower hand, twist and turn. Stay. In yoga, it is very important to do 2 things. In any asana, absolutely any asana. First is to make sure that you breathe in while you're doing the asana. So, even if you turn and you sit, even if it is difficult, you have to learn to slowly breathe. That is most important thing. Second thing, any asana, you have to keep a smile on your face. Yeah, you know how if you're feeling happy, you will have a smile on your face on your own. Right? The same way, if you have a smile on your face, you will soon start feeling happy. So it works either way. Yeah, so absolutely any asana. You have any problem, a stomach problem. Yeah, it's annoying you. But still, 2 things. One, you have to breathe while you're doing the asana. Second, you have to smile. Now, once you're done with those asanas, what we just did was hip opening asanas in the start. Yeah, first 2. After that, the next 2 that I showed you were twisting asanas while you are standing. Now you're going to move to another one. Sometime back, what we done was belly, 45 degrees. Right? We done this. Now, from here, for those who are comfortable, what we're going to do is take your hands, move them behind your leg. Okay. So, घुटनों के पीछे कभी नहीं रखते. Because you'll end up doing this. घुटनों के पीछे नहीं, घुटनों के नीचे. Wherever you're comfortable, you will hold there. Once you've held it, bring your chest close to your thighs. Now, in this position, this time you're not trying to touch the ground. That is not your point. The point is to press your stomach. So, your chest should touch your thighs. Move your hands behind. Bring them close. Okay, if you want, you can bend your knees more. If it's okay. So, you can do this and hold. The only point is to bring your stomach close to your thighs. Now, most of the other asanas that we do, if you have a knee injury or knee pain, even slight pain, then it will aggravate the pain. Okay, अगर आपको knee का कोई भी problem हो,
तो काफी सारे दूसरे आसना में नी आपको घुटने की तकलीफ हो सकती है, लेकिन इस आसना में अगर आपको घुटने की तकलीफ हो तो भी आप कर सकते हो, because you are not, there is no strain on your knees. So this, bend, come down, press your stomach to your hands. It's a very simple, a very good asana. Now, the next one we're coming to the most best asana for absolutely any gastric problem. Okay, it's going to be really good. That is Malasana. Okay, what you're doing, or Indian toilet pose. Yeah. Now we've all shifted to English toilets, most of us, but the Indian toilet pose is the right way of allowing any bowel movement through your body. So, keep hip distance between your legs. Calm down. Okay, your buttocks slightly above the ground. Yeah, once you have sat down, and you can do this. Use your elbows and your shoulder strength to make a namaskara in the middle, right at the center of your chest, and move your legs away. Yeah. For most people, because we're not used to sitting down, okay, even sitting like this can be very difficult, right? It is. So what you can do is yoga blocks or use any tough material, place it under your buttocks, and you can sit on it. Okay, पहले तो आदत के लिए you can place something under your buttocks and sit. For some people, if you feel like you're falling behind in the start, you can even take the help of a wall. Back straight, sit. Buttocks off the floor. Just sit. Once you're used to this position, once you can do this, then you move forward. Okay. Namaskara. Start with this. After a few days, maybe you can do this. After a few more, maybe you will be able to do this. It's a very good asana for allowing bowel movement through your body and out of your body. What is most important is keep your spine straight. ये करके नहीं बैठना. Okay? You have to keep your spine straight, erect, and then do the asana. After this, we can now start moving to asanas that we can do while sitting down. 1 second. Okay. Now that we're sitting down, and this is a second set of asanas that we're looking at. First set was all standing. Second set, all sitting. So we'll again start with very simple ones, which anybody can do while sitting down. Okay. We're sitting in Sukhasana, normal cross-legged position. From here, move one hand on the ground, the other hand over your head, and bend. Stay for some time. Same thing on the other side. You are extending your abdomen on either side. After this, one forward bend. Okay, keep your hands behind. Touch your forehead to the ground. You have to go down straight. You have to press your forehead to the ground, not the head. Okay. So go down straight. Try not to lift your buttocks off the ground while you're doing it. The stretch is supposed to be in your spine, and you're supposed to crunch your stomach while you're doing it. Yeah. Next, we're looking at a twisting asana. One side, one hand opposite me. Other hand, center of your body behind. And then twist. Same thing on the other side. And come back. Okay, these are very simple. They almost seem mundane. But even simple small exercises while you're sitting down, while you're working, it will benefit you a lot. Huh? So always remember what we're doing is bending, crunching, stretching your gut system, and you're twisting your gut system. Okay, in standing also we did that, and sitting also we did that. Okay, now we'll move to some other exercises which will strengthen your gut. Yes. So we'll move into cat and camel pose, or for which you will first take one forearm. Okay, you're sitting in Vajrasana, one forearm, then one palm. And once you have this, breathing in, come up. Breathing out, come down. Breathe in. You see your spine is supposed to become like a cat. Okay? You should bend your spine. So come up, breathe out, come down, up, down. It is very important to do this asana along with the breathing. Come up, breathe in, come down, breathe out. Has to be slow, deep breathing, and do it as clearly. Bend your spine up and down as much as you can. That mobility in your spine is very important. Yeah? Now from here, we're going to move to, now that we've done some bending here, we're going to move to one backward bend while you're sitting. Okay? Knee. Okay? From Vajrasana, you have to come up in knee. Okay? Use your hands. Place your palms on your heels. Come back. Slowly come up and sit down again. Okay? For people who can't directly do this, yeah? You can come on your toes. Okay, पहले ऐसे था कि your foot is flat on the ground. Now come on your heels, come on your toes. Place your palm here. Push yourself forward and head behind. Slowly come up and sit. Okay, very important that one, when you're bending back now, you have to continue to breathe. Breathe very slowly. It'll be difficult in the start, but you have to learn to breathe in absolutely any position. And when you've done this, push your hips forward. Okay, chest up, head behind. And slowly come up. Very important to come up slowly. Don't jerk your body. Don't do it in a hurry. You should never do an asana like that. Once you've done one backward bending, it is very important to do one forward also. Otherwise, you'll have this sort of discomfort in your body. So, another asana, which is we're doing it because we did a backward bend, we should do a forward bend. But second most important reason, it is a very good crunching asana for your stomach. We're going to do Balasana or Shishu Asana. So, going to do Shishu Asana or child's pose. Crunch your stomach. Bring your chest close to your thighs. Hands forward. Head on the floor. It's a very popular resting asana. This child's pose, leaves you very comfortable when you're doing it. Yeah? So, very simple asana also. We We brought our chest close to our thighs while we were standing also, but that can be difficult for some people. So sitting in Vajrasana and then bringing your chest close to your thighs can be very comfortable for a lot of people. It's a very good asana there. Now we're going to move to one asana in prone and two asanas in supine. And that's all for today. Yeah. So prone position is when you're lying on your stomach. Okay. So you have to lie on your stomach, lay down flat, and we're going to do cobra. Cobra is to lift yourself up. Okay. From here, lift yourself up as much as you can. Okay, the weight is on your palms. First, when you're starting, your palms next to your chest. This is your chest region. So palms next to your chest and lift yourself up as much as you can, not too much. Okay, you should feel the stretch in your spine, behind. You should feel your abdomen stretch in the front. Come up, look straight. Come down slowly. Now, again, very important to breathe while you're in the position. Yeah. We're going to move to the last one, which is lying down on your spine. Lie down straight. And we're going to do one twisting asana, for which bend one knee, fold it, bring it down to the floor. Now on the other side, you have to twist, turn, look, and stretch your palm. Continue breathing. Same thing on the other side. Bend your knee, bring it down to the floor. Twist and turn, look to the other side. Then come back straight. This is a very good asana to twist your spine. Also, it crunches your stomach, twists it so that your digestive system is getting some help in crunching and digesting. Okay, so we have seen very similar asanas of bending and twisting in standing, sitting, supine, and prone.
थैंक यू थैंक यू महती जी, आपने बहुत अच्छी अच्छी जानकारी दी। हम तो आपसे आज बहुत बात करना चाहते थे, क्योंकि आपने ऐसा टॉपिक चुना था, ऐसा सब्जेक्ट चुना था कि ये प्रॉब्लम हर घर में है। तो हम तो ज्यादा से ज्यादा बात करना चाहते थे, कुछ क्वेश्चन भी पूछना चाहते थे, लेकिन आज वक्त नहीं है हमारे पास। हम कोशिश करेंगे कि आगे के शो में हम इनवाइट करें आपको आगे के एपिसोड्स में, और बाकी बातें करें, आपसे खूब बातें करेंगे। बहुत बहुत धन्यवाद हमारे शो से जुड़ने के लिए आपको।
थैंक यू जी।
और अब शो को आगे बढ़ाने का वक्त है, और क्विज, आज का पहला क्विज क्वेश्चन सुनने का, देखने का वक्त है। तो हम चलते हैं मिस्टर आर शंकर के पास।
Thank you, Kishore. I think, Mahati, it was a wonderful, wonderful show from your side. Very easy asanas. It was quite lucid, and the flow was also very good. We'll come back to you later. We have the quiz number 1 now. So the quiz number 1 is, which of the following statements concerning yoga for gut health is incorrect? A, performing yogasanas just after a meal can help in easier digestion of food. B, yoga improves blood cell circulation throughout the body and helps in better absorption of nutrients. C, gastric problems like constipation, heartburn, and stomach cramps can be cured by practicing yoga regularly. And D, certain specific yoga poses can have a detoxifying effect on the body. You can answer these questions at the end, and those who are correct, they will get a certificate. We now have the montage. Well, we now move on to your health counter, where Padma Shri Dr. Shashank Joshi, who occupies the chair Interventional Diabetic Federation Southeast Asia and a reputed endocrinologist, speaks on the third wave, Omicron with Delta. What's new? This is a record version of our earlier episode. Over to your health counter. The third wave, Omicron with Delta, what's new? We have in this your health counter, where Heal Foundation and Heal Health founder and one of India's top health communication expert, Dr. Sudeep Srivastav, will be in conversation with top health experts. Heal Foundation and Heal Health, which have been at the forefront of healthcare awareness through healthcare communication, and has been instrumental in creating campaigns and platforms for healthcare improvements in India for the last 2 decades. He will be speaking with Padma Shri Dr. Shashank Joshi, who occupies the chair International Diabetic Federation Southeast Asia. He is a reputed endocrinologist at Joshi Clinic, Leelavati Hospital, and member COVID-19 Maharashtra State Task Force. Dr. Joshi is the president of 2 important organizations, the Indian Academy of Diabetes and Association of Physicians of India. He was also former president of Research Society for Study of Diabetes in India and the All India Association of Advancing Research in Obesity. He is the former vice president of Association of Physicians of India and is now its advisory board member. Long time I'm meeting you, Dr. Shashank. I think we met last in Delhi for almost more than 3 years back, and glad to see you back again here.
Welcome, Dr. Joshi. So today's topic, third wave Omicron with Delta, what's new? And I'll give the stage to you, sir. In terms of your perspective, with this in mind, that in the end we will definitely have 3 to 4 very important questions before we answer. Is about the first is the perception of this Omicron coming and making this pandemic an endemic. Second is a lot of confusion and discussion around herd immunity theory. And third is about COVID pills overall generally, from most of them are under emergency use authorization. So what people should understand about, because there's so much of news going around on COVID pills which confuses the public at large. And most importantly, in the end would be, when would this COVID pandemic end?
Probably for the first 10-12 minutes, I'll share some slides. And probably in the next maybe another 5-7 minutes, take some of your questions. 2 things before I start any of my presentation are 2 caveats. First is, COVID is predictably unpredictable. And COVID science is a unpredictable science. Whatever science is done and is published, by that time that science gets published, the new variant has emerged or a new pattern has emerged. So science is always falling behind. For example, you mentioned your last question that there are some new age antiviral pills. Their research was done in unvaccinated population, and now we have a vaccinated population. So obviously the goalpost keeps changing all the time. So with those two caveats in mind, that COVID is predictably unpredictable, and the goalpost in evidence-based space keeps changing, it allows a lot of speculation in era of evidence-based medicine. So I will try to share some slides and make things a little simplistic for everybody for two things. That we are in the third wave worldwide. Maybe there are more waves, but this wave is like a tsunami. And there are two camps, which Pradeep said. One is a camp called inevitability camp, and another camp is called as the avoidance camp. So the inevitability camp says, oh, this is a mild variant. This Omicron is a mild variant. The lung-to-lung cell virulence has 5 studies, but it's still mild. The vaccine infection, even if you have natural COVID, if you have taken the vaccine, there are T cells which hold up very well. So, it will protect you from severe disease. Even if you take an extra precautionary dose, it's immaterial because it's for a short duration. The long COVID, don't worry about it. This will just be like a natural infection, you'll be done with it. There are many new pills, but you don't need it really. And it's all about herd immunity. Okay, so this is actually your question, which Sudeep, I didn't know you would be asking this, but this was my first slide. But there is another camp which says it is less severe, it's not mild, it's less severe. So it's very, very important to recognize this thing. Hamsters, mice, culture disease don't make people. So yes, Omicron is a nose and throat disease, but not a lung disease. While Delta is a lung disease and we have a little bit of both. Delta kills, Omicron is unlikely to kill. Okay, but remember that there is always many people who are aged or immunocompromised or cannot mount the immune response, including you and me. So we don't have an assured layer of defense. Okay, then also, though we are taking extra doses, there are plenty of breakthrough infections. In fact, most of the Omicron which is occurring in Mumbai and Delhi today is the people who already had COVID in the past and already have had 2 doses. Okay, it's very important to know that there is a lot of long COVID there. And people, even after Omicron, we are in the 3rd to 4th week in Mumbai city. Even today morning, I was talking with a case of mine who is persistently having persistent fever and giddiness with a lot of fatigue and tiredness, feeling of drained out. So there is something called long COVID, which we can't dismiss even in Omicron. And pills are there. They have a role, but their role is limited and selected. And obviously it's a very transmissible, it's the most contagious virus probably. It's a new beast, the Omicron, and we need to contain it. We need to contain it very quick and fast. So this variant came with a lot of mutations. And this football-like virus had spikes. And the spikes have got really mutated. So 32 mutations on the spikes. And the attachment of these spikes in the lungs is through the ACE2 receptors. And that entry point also had 10 mutations. So both the entry point had 10 mutations and the spike had 32 mutations, 50 plus mutations. So obviously, and it originated in Africa, probably in Botswana, in an unvaccinated population, but moved to South Africa. And probably that beta, it was there probably when beta was around. But beta got replaced in South Africa very rapidly by Delta. And now Delta, in a span of 10 days in November, got replaced by Omicron. So it's all the story of Omicron, which is now ravaging worldwide, is between 11th November to 23rd November. So that's really the story of it. And it deletes the S gene. The virus has different structures. There's S gene, E gene, N gene, RF gene. So the S gene is deleted. So that's the easy way to find it out, to delineate it. So the old beta, gamma, delta was originating in India, gamma was originating in Brazil, beta was originating in South Africa, and then we have this new strain. So what are the issues? Is it more transmissible? Yes. It's a rapidly contagious virus. Does it immune escape? Which means if you had COVID or if you had vaccine, yes, it has immune escape, but it saves lives. Because the virulence is less. The severity is less. That's very clear. It may be less severe, but it is less. And initially it was sporadic or travel related. Now there is community transmission. So that is what we know. Rapidly transmitted, super mutant, R0 is unknown. It is replacing Delta, but Delta is still there. So when Sandeep told me to talk, I said there's still Delta around in hinterlands of India, in large geographies of India, and we can't afford to miss that Delta. So remember, if you have nose and throat COVID, a lot of sore throat, a lot of headache, backache, with a lot of fever, it's likely to be Omicron. But if you have lost taste or smell, if you are out of breath, and if you have a lung involvement, it is likely to be Delta. And the Delta is being replaced by Omicron, but there's still Delta, 5, 10, 15% in different geographies. So it's going into a cluster wave. It's very contagious. Immune escape and breakthrough is there, but severity and virulence probably early is very less. So obviously, you saw this was the South African. They had the first wave with the Wuhan strain, second wave with the Beta strain. Beta got replaced by Delta, and Delta got replaced by Omicron. So if you head-to-head compare Delta and Omicron, you can see the mutations. This is a graphic picture of Delta versus Omicron, and you can see it graphically. There's a big difference between Delta and Omicron. Omicron is having a lot of mutations. You can see all those mutations. Okay, but it is an evolutionary virus. So it transmits fast, it evades immunity fast, but probably the disease it causes is more localized in the nose and throat and upper airway, while Delta has less mutations, also transmits faster than the original strain, but goes deep down into the lungs and can cause you hypoxic, make you breathless, and can kill you. So that's really the difference. Well, for us in India, we have a single target: 0 COVID deaths and less severe disease. And this was what I wrote in May 2020, when the first wave was there, that we need to identify people in India who are vulnerable and at risk to die. So people who are above 50, 55, male gender, hypertension, diabetes, obesity, chronic heart disease, chronic lung disease or asthma, chronic kidney disease or liver disease, any congenital or acquired immunodeficient state, or users of steroid, immunosuppressants or transplant recipients. This is our high-risk group. This is the population to protect. This is the population to save lives. This is the population to stop these and save them from hospitalization. Whether it is a Delta, whether it is a Omicron is less severe, Delta is more severe. But if you are asthmatic, if you are hypertensive, if you have obesity, if you have diabetes, if you have chronic kidney disease, if you have severe obesity, or 2 or 3 of these conditions, your risk of hospitalization and death goes up significantly. And this is a rapidly transmissible strain. It has a viral competitive advantage. It is 500-fold viral competitive compared to a Delta or an original strain. So clearly, its lineage has now 2 lineages, BA1 and BA2. So there are 2 sub-lineages. In Calcutta, 80% is the lineage 2, which may duck the RT-PCR test sometimes. And these both lineages really don't matter because they are very contagious. So transmissibility is the highest, disease severity is low, and escape from vaccine or natural infection is the highest. So there are 3 types of COVID we see in practice today. One is people who are completely unvaccinated and no past COVID-19. They are at highest of risk. So somebody, very rarely we find this now. In Mumbai city or Delhi, we rarely find it, but in hinterland we'll find it. And even in Delhi and Mumbai, we still see such patients, which means they have never received a single vaccine, never got COVID in the past. This is called COVID first infection. They also are at high risk because they don't have a exposure to the virus. Then we have breakthrough. This is the commonest group which we see, which means they have either had 1 dose of vaccine, 2 doses of vaccine, or even they have taken a booster, or COVID reinfection, which means they had infection in first or second wave, they have got reinfected, or a mixture of both. So this is what we are seeing in our population every day. This was the old timetable. 80% had no or mild symptoms, 14% had severe symptoms, 5% received ICU care. This was the Delta pattern or the Wuhan pattern. What is the Omicron pattern? Well, the mild disease or asymptomatic disease has moved from 80% to 95%. The severe disease has moved from 14 to 4%. And the ICU has moved from 5 to 1%. So this is the big change today, that as the virus has evolved, it has become less sinister. And this is, but you still need to distinguish both because you still need to save lives. And that's the challenge we have as doctors. most of us as human beings have a very robust immune system response. So we'll clear by very good interferon, by Th1 cells, which are T helper cells, by very good B cells, which make neutralizing antibodies. But the unfortunate vulnerable few won't have an immune response. They will falter, they will not make interferon in their body, their T cells will get exhausted, their natural killer cells will get exhausted, and they'll accumulate negative chemicals for cytokines, and they'll get a cytokine storm. So there are three stages of the disease. 95% of current COVID will be in the early stage, which means mild, asymptomatic. But if there is persistent fever, persistent cough, you need to red flag. Persistent fever, persistent cough, if you have breathlessness, you need to red flag. The second stage is lung phase. There is virus. If the lung is affected, clearly it is likely to be a delta. There are opacities, there are glass opacities, and then of course the body's immunity becomes hyperinflammatory. You get cytokine storm. So obviously we still need, as Swadeep rightly said, oral antivirals and immunomodulatory agents. But we are in an era of evidence-based medicine. And in evidence-based medicine, in the COVID era, the recommendations are A, B, and C. Strong recommendation, moderate recommendation, optional. And the rating of evidence is 1, 2A, 2B, and 3. So 3 is expert opinion, 2B is non-randomized or observational studies, 2A are randomized trials or subgroup analysis of randomized trials, and 1 is randomized trials without major limitations. So that's how it has been highlighted. The easiest test to do is don't run for too many tests. You can just do a CBC or a simple complete blood count. If the IDW is more than 14.5, you could be likely to deteriorate or become severe, or if the new NLR or CRP. Occasionally we do LDH or D-dimer or ferritin, but that is with doctor's discretion. So COVID-7 is very simple. Monitor for fever. If the fever is more than 100 for the next 3 days, put him in the hospital. But paracetamol is the drug of choice, and keep giving paracetamol 500 to 650 milligram 2, 3, 4, 5 times a day. No problem. If your pulse rate is very high and inappropriately high, you probably need to be in the hospital. If your respiratory rate is high and you are out of breath, you need to be in the hospital. If your sugar and blood pressure needs monitoring, and connected with your doctor. But the COVID stethoscope is still, whether it is Delta, whether it is Omicron, is still the pulse oximeter. Oxygen saturation is the key. Measure the pulse oximeter properly, saturation. If it is not, after, then do a 6-minute walk test. And if it is still perfect, there is no drop of 3% or it's not below 93%, you are good to go, and be connected with the patient. Now, more important thing is, because we rely at home isolation, everything is on pulse oximeter. So person should be resting without a mask, breathing quietly and not talking for some time before you do pulse oximeter. Warm the fingers because it's very, very cold in a lot of parts of India, and ensure that you use the middle and ring finger. Right, don't use a nail polished finger. Old extremity should be warm, and wait for a 60 seconds before you see the pulse oximeter readings. It's still the key. You still can miss an occasional delta. So the new COVID of Omicron is 7 to 14 days. Most people will become okay in 7 days, otherwise they need hospitalization. The old timetable was 14 to 21 days. But after COVID, for 3 months, you need to be vigilant. You must, if you have comorbidity like blood pressure, heart disease, kidney disease, diabetes, you need to monitor. Right approach, right time, right medicines. There is no need to give antibiotics, antimicrobials, antiparasitic agents arbitrarily unless your doctor feels there is a secondary infection. Always insist to talk to patients on phone, and don't forget to give life-saving drugs like an antiplatelet drug, a statin or an anticoagulant, high-risk cases, because we still are the cardiometabolic capital of the world. Well, sometimes we give persistent cough, we give inhaled steroids. But we need to identify who is dying. So senior citizens, people with lung, heart, diabetes, obesity, chronic kidney disease, immunocompromised and transplant people are the ones. So the very high risk populations are these 5. And we need to save their lives. People who are solid organ transplants, people who have blood cancer or active chemotherapy patients, people who are on dialysis, immunosuppressive therapy or immunodeficient people. These are most likely to die. And that is where these new age therapies come in the picture, like an antiviral therapy or antibody therapy, which has become very popular, but you need to delineate it. If it's a delta, they will definitely work. If you don't have immunity, which means your behaving like an unvaccinated population. That means your immune response is poor. For example, a lot of people have a spike protein which is positive, but a nucleocapsid antibody or virus neutralization test is negative. Then that means they have weak immunity, or they are behaving like unvaccinated population. That is where an antibody therapy will work if it's a delta, if there's lung involvement, or an antiviral drug may work. So this is something which we need to recognize. So remember, home isolation is the key. And Government of India has got excellent guidelines now on home isolation. And only for people who are elderly, above 60, with hypertension, diabetes, heart, chronic liver, lung disease, kidney disease, cerebrovascular disease, will only be there if the doctor feels they should be home. Otherwise, home isolation is still the key. Isolate yourself in a well-ventilated room. Try to use the proper triple-layer mask. Discard mask after 8 hours. Cut out the mask. If there's a caregiver, use N95. Rest and hydrate. Sleep for a good 8 hours. Maintain some respiratory etiquette. Do not share your personal belongings, and keep monitoring your temperature and saturation. You must take your medicines for comorbidities. You must do teleconsultation. If symptomatic management of fever, running nose and cough is warranted, do warm water gargles and steam inhalation. Paracetamol 650 milligram 4 times a day. Do not get misinformation by social media. And I think I congratulate Heal Foundation for last 20 years. Swadeep, Shankar and your whole team. Swadeep, you all have been doing excellent service to humanity in general and Indian community in general, because you have given the right information, because there is no need to panic, to do unnecessary tests and treatments. Do not rush for self-medication, blood test or X-ray or CT scan unless your doctor feels it is needed. Steroids are not indicated for mild disease. It should not be self-administered, and treatment should be monitored, for each individual is different. So it's very, very important to recognize that who should we admit. This is the most important slide. Okay, if somebody has difficulty in breathing, somebody has high temperature for more than 100 degrees for 3 days, somebody's saturation is dropping down below 93%, at least 3 readings within 1 hour, or the heart respiratory rate, person is breathless, more than 24. There is persistent pain or pressure on the chest. Person is confused or person cannot be aroused. There is severe fatigue and myalgia. If any of these 6 conditions are there, please admit the patient. There is no harm, because these are the people who need admission. Every life matters. When to discontinue? Probably, we know that if person is asymptomatic for 3 days, no fever, okay, you can release them from self-isolation after 7 days. So there has been a lot of changes in the guidelines, in the discharge policies for mild cases. But if there are moderate cases or severe cases, the old dictum still stands. And obviously, there are excellent guidelines now for turnaround time for healthcare workers and so on and so forth. So I will stop here probably, but there are 2-3 things which I want to say. One is about monoclonal antibodies, second is about molnupiravir, and third is about the vaccinations. Because the monoclonal antibody is very good for it's a life-saving treatment for Delta, or if the lung is involved. So your doctor might decide it's a good option to give. It's a level A evidence, and this cocktail antibody, which was given for President Trump, was in the Delta wave, is very useful, and also for caregiver for prophylaxis. So excellent data available. Omicron data is not available, but it's unknown. So it is not banned, but it's unknown. So right now we say if you are suspecting a Delta, it's good. If you are suspecting an Omicron, it's unlikely to respond. So there are a lot of other antibodies which are coming up also, which might have, like sotrovimab or the other antibodies, which may have a role in Omicron. So antibody in Omicron world, if it's a Delta or if there's lung involvement, they may have a role. Otherwise, the role is limited now. As far as the molnupiravir has been concerned, and the new age agent, the nirmatrelvir and ritonavir is concerned, yes, it may have a role, okay, because it's a chain terminator. Okay, so if somebody has persistent fever for more than 2 days, okay, and you are above 50, and you have more than 2 or 3 comorbidities, your doctor might give you this agent. So there is nothing to get worried. We don't give it for children below 18. We don't give it for people who need hospitalization. We don't give it for people with childbearing potential. And it has very good data. Mind you, the trial was prematurely terminated because when Merck was doing the trial in the US and it has publication in the English Journal of Medicine, the people felt that the placebo group, were denied of the population, and it clears the virus in 3 days. So very, very good data on molnupiravir. I do not 30% reduction or absolute relative risk reduction of 3%, but social media is very gung-ho about it. No drug-to-drug interactions, but avoid it in pregnancy, lactation and pediatric patients, and has impact on Omicron and Delta both. So it's a very good broad spectrum antiviral. It has an EUA in UK, USA, Japan, Denmark, Philippines and India. It reduces hospitalization and death by 30%. It improves clinically patients, but use it in people who deserve it the most. Then of course this new agent is very good. It's not available in India, so I'm skipping it. It's called as the ritonavir boosted therapy. Again, in high risk groups, it's very good. So if you summarize the antibody, the molnupiravir, the Pfizer pill, you need to start them early, hit hard, hit early. You have to give them in the first 72 hours. They reduce hospitalization from 10 to 3%, monoclonal antibody, molnupiravir from 10 to 7%, only 3%, and the Pfizer pill by 7 to 1%. But the efficacy on hospitalization and death is 70%, 30% and 85%. Obviously, remdesivir has come back. There is a 3-day study in remdesivir, which can be very, very useful in outpatients for 3 days, which can clear the virus quick and fast. And then, of course, we have these new age agents which we give, tocilizumab, itolizumab, which also can have their own challenges. But remember, and steroids. Asymptomatic Omicron, comorbidities or no comorbidities, observe, no blood test, no treatment. If you're not symptomatic, you don't need anything. Don't even test, don't even treat, observation is the key. If you're symptomatic without fever, which means just the nose and throat and cough, but you have comorbidities, you might sometimes need symptomatic treatment like a cough inhaler under medical supervision. If there are no comorbidities, again, you might just need symptomatic treatment, which means paracetamol becomes the treatment of choice. But if you're symptomatic with fever and you have no comorbidities and you are probably above 60 years of age, one may be offered molnupiravir. If you have no comorbidities and less than 60 years of age, paracetamol and symptomatic treatment, you can give molnupiravir, but it's at individual discussion. And then, of course, if you are symptomatic with lot of comorbidities, then either you admit the patient and give remdesivir, or you might sometimes have to give other options. So there are a lot of these options which are there. Delta variant, the monoclonal works. Omicron variant, it's molnupiravir, remdesivir may have a role. And in hospitalization patients, remdesivir works. This is what is the current age. But our whole idea is to save lives. We want to get zero COVID deaths. We don't want severe disease. We want ultimately COVID to become a mild, manageable, endemic disease like dengue and malaria. And maybe Omicron is a change. So, what I have tried to do here is summarize some things that we need to be responsible. And on 16th of Jan, as we talk, Swadeep, in this whole COVID-19 treatment conundrum, we definitely need to save every life. For me, if you ask me, saving every life, saving people from severe disease is the key in COVID management today. And that's our medical focus, if you ask me. And for that, outside in the community, you just had a beautiful panel which said, double mask, air ventilation, that's the key. And when you unmask, be alone. It's better that you and me have a cup of tea at our respective houses rather than sitting in front of each other or have a little bit of idli with shankar. But that's the key. Okay, meet digitally or virtually. Okay, and not physically for some time. And the disease will get endemic. We are heading for endemicity. I don't know that herd immunity concept has been faltered and broken through. All the walls have been broken by Omicron. But that doesn't mean that we are not protected or safe. Also remember, US, Europe is ravaging with a pandemic of the unvaccinated, with a lot of Delta there, which is why the deaths are very high there. While in India, the replacement of Omicron of Delta by Omicron has been very rapid because the Delta has already gone away. See, when the wave has hit India, okay, the Delta had already moved out in most geographies, except probably Kerala, Maharashtra, Northeast India. Most places like Delhi, the full Delta had gone. So we got fresh Omicron. While when the Omicron landed in Europe and USA, they landed when Delta was also there. So they got a double whammy. And that is why they are seeing very large numbers and large deaths. That's the truth of science as it stands today. As I said, I've tried to be as evidence-based as possible. Okay, but these are areas, as I said, we are learning every day from this new virus. The human body is as smart as the virus, and the war will continue. But every new strain, probably the virus is evolving to be a milder one. That's the evolution of pandemics. If you see history from Spanish flu, then ultimately we still have flu around. We still get flu today, but we can manage flu. We have a vaccine for flu, and we can still manage flu. And hopefully, let's hope that though COVID, we may have to live with it, we will be able to be making it as a mild manageable disease, and we need to have zero COVID deaths. That's really the current aim for all of us.
So, sir, when you talked about COVID pills, sir, like starting from because most of these COVID pills are under emergency use authorizations. So, first, for particularly from a general public point of view, what would this mean, emergency use authorization, from their perspective, what they should understand about it? Second would be like so many guidelines and counter opinions coming on pills. So how much people should actually absorb and believe? Say in case of even you just spoke about molnupiravir, and that has started with remdesivir also earlier. When remdesivir started, WHO gave a different statement, and then now it is in regular practice by the practitioners are saying. So there's always also a clash of opinion between the researchers, scientists, and the practicing doctors who are seeing something else or some better benefits while they're treating patients, particularly when limited options are available, sir. So how can you answer this, particularly what people should know about emergency use authorizations?
See, all drugs, normally a drug takes a couple of years. Vaccines also take a couple of years to work. So whether it is a drug or a vaccine, these are all early use and rapidly developed vaccines. Normally, if you see in the history of medicine, vaccines took 8-10 years to develop or 20 years to develop. Similarly, for any new therapy to come, it takes a couple of years to develop. So obviously, these are all repurposed drugs which have been used overnight. But the data generated, as I said, has been reasonably robust. And the new age pills which are coming in, whether it is the latest data on remdesivir, the latest data on molnupiravir, that is saving lives. See, we started with the story of hydroxychloroquine, ivermectin, and the early remdesivir days when there was no data. So we started with nothing, and only we found out that dexamethasone worked only in severe cases, and oxygen and prone position and nursing care. So that is how therapy evolves. So when we have a new disease which is evolving with new strains, obviously we will have new age agents. We have to choose the most vulnerable group. So for me, as a treating doctor, it's a very simple algorithm. Look, for lay people, they should go by their doctor's advice, because every patient is different and the profile of every patient is different. So if somebody is asymptomatic, is 85 years old, has just mild hypertension treated with one tablet, completely asymptomatic, CBC, CRP, nothing is needed. You just need observation. You need temperature monitoring and saturation monitoring. But the same 85-year-old has a little bit of kidney issue, has hypertension, diabetes, which is very high, probably, and is symptomatic with persistent fever of 100 and above, probably will need, if can be managed at home, an oral pill, or may need to go to a hospital and need an injection. So every case is different. For me, who is most likely to die? For me, every human life is important. So the idea of using these patients and these pills are in the most vulnerable groups. Unfortunately, what happens is, lay people feel that this is like a magic pill and the pill gets used indiscriminately. And that's where the Lakshman Rekha has to be drawn by the treating doctors as well as the lay people, to draw a line that if my doctor is saying that this pill is not good for you, this injection is not good for you, you don't need to take it. That's where we really need to self-regulate, which is why I think I must admire Government of India has been very prudent, but their approach has been very socialistic in nature for most of the people, most of the time. While for us as clinicians, for every person living with COVID matters, and every life is equally important. So saving that life in the vulnerable group who's likely to deteriorate definitely matters. And if there's data and evidence to show that it might be saving lives, and all these newer therapies definitely have data to show that at least in the Delta variant, they save lives. So if there's lung involvement, they save lives. If there's just a nose and throat COVID, see what is the Omicron today? It's predominantly a bad sore throat. And if it's a bad sore throat, I think it's a little more worse sore throat with fatigue. Most people will do very well, whether you treat them or you don't treat them. It's symptomatic treatment. Let me be very transparent. I know pharmaceutical industry may not like what I'm saying, but I must compliment them that they have got these therapies to save people who are most at risk to die. And that is where you should use it. So I think we need to really know when to use, what works, in whom it works, how it works.
Welcome back. We now have your health counter with Dr. Sanjay K. Rai on COVID-19 endemic. What's the end game? Before that, I would like to remind our viewers that we are live on Facebook and YouTube now. Dr. Sanjay Rai is currently professor at Center for Community Medicine, All India Institute of Medical Sciences, New Delhi. He is also the editor of the prestigious World Health Organization Southeast Asia Journal of Public Health. Speaking to him will be Dr. Swadeep Srivastava, one of top health communicators and the founder of Heal Foundation and Heal Health, which have been at the forefront of healthcare awareness through healthcare communication and has been instrumental in creating campaigns and platforms for healthcare improvements in India for the last 2 decades. Over to you, Dr. Swadeep. You're muted, Swadeep.
Sorry. Welcome, sir. Namaskar. Good morning, Dr. Rai.
नमस्कार सभी लोगों को.
From this chilly Delhi, sir. ठंड आज अब तो लग रहा है कम हो रही है धीमे-धीमे. So welcome to this 6th episode of Your Health Counter, sir. And here, I'll just to set the background, so I'll take 2-3 minutes to set the background for this talk and half an hour thorough discussion with you, sir. That we have been interacting since the beginning of COVID-19 pandemic. So almost 20 months we have been interacting. आपसे हमेशा किसी ना किसी शो किसी बहाने वार्तालाप होती रही है. And you have been outspoken on the following issues and have been insistent on scientific facts and data-driven interventions at policy levels. And that has been one of the key attractions for inviting you for this show, sir, because you are one of the very few persons in this whole ecosystem of COVID management who have been continuously insisting on this. So a few of them you have been outspokenly talking in the media as well as sharing your unbiased, bold views through various platforms, including what you have been writing on tweets. I would like to touch on a few of the important issues and take your open and frank views on them one by one. Rather, I will just give the backgrounds. You can cover as many in your presentation and your talk, sir. If anything is left, we can discuss in the end, sir. The first point is natural immunity provides better and longer duration of protection. When you say, since the beginning of pandemic, WHO's role has been doubtful, its obsession with vaccine is questionable. Very bold statement, sir. So I'd like to have your view. Would request you to elaborate and provide more scientific insights on this in your talk, sir. Your distinguished colleague, Dr. Professor Amitabh Banerjee, who has also been a regular on our show, sir, said you, and you endorse it equivocally, that rushed mass vaccination with poor public health infrastructure is like running a super fast train on the old rickety tracks. What do you think would have been a better and scientific way of vaccination drive? We have covered a few points earlier also, but for our viewers, a lot of new viewers keep adding. People always want to know that clarity is still not there. The scientific way of vaccination drive in a vast country like India with complexity of challenges. Then the third point is leading public health experts, including our guru, Dr. Professor Chandrakant S. Pandav, have been pointing out at overwhelming focus on COVID resulting in neglect of other important diseases and health issues and affecting other vaccination drives, etc. Dr. Professor Banerjee also recently wrote an article on Our Children Health Issues. Daily 2,000 children in this country are dying with preventable causes and not because of COVID. So how do you think we can overcome this and come on the right track with respect to implementing universal health coverage to all our people coming out of the hangover of COVID, I would call, and you also always call the hangover of COVID. You also highlighted a Harvard professor of medicine, Martin Kulldorff, views on children vaccination against COVID-19 is unscientific. So can you explain it further? It creates a double whammy in the minds of parents too, when we see that the developed countries have already vaccinated their child population, and here in India, everyone, including my wife, my daughter's mother, is eagerly awaiting all our children to get fully vaccinated. Also, on views on related topic on how effective would be booster dose? Is 9 months gap justified? Mixology, some studies are showing mix of vaccines working better than same dose of booster. So these are just the points we can touch on, sir. And your view on your recent statement, and that is one of the latest one, is still in debate going on, is looking at the COVID-19 vaccination status and the natural infection. We can say that very soon the majority of us will be getting an infection, and thus this virus will convert into endemic, says Dr. Sanjay K. Rai, you told ANI in a statement. Then WHO came out with this statement, the COVID-19 pandemic is far from over. The World Health Organization chief said, cautioning against a narrative that the fast-spreading Omicron variant is risk-free, this pandemic is nowhere near over, said Tedros Adhanom Ghebreyesus told reporters from the WHO's headquarters in Geneva. Is it contradictory, or you both are pressing on the same point in different ways, sir? Particularly, what we expect in this show is more what are people. So, of course, Lisa, you're talking of as a public health leader and a crusader and an expert. You're talking of public health outlook, public health professionals outlook, epidemiologist outlook. But how do the people in general understand these on all these topics, sir? Over to you, sir, for your uninterrupted next maybe 20-25 minutes, sir. 20 minutes.
So thank you, Dr. Sudeep. Thank you very much for having me here first. You have asked many questions, more than 10 questions. I don't know in 20-30 minutes time, and you have said that kindly make a presentation also, right? So what I will do, I will finish this presentation. I will skip all the slides in 5 to 10 minutes just to show the current situation, right? And then questions. So better to ask questions. It's very difficult to remember all these questions, and then I will reply. Right. So the current, what I will do, what is the current situation? I will share with everybody. So is my screen is visible?
Yes, yes.
Okay. So as you said that COVID endgame, we'll discuss COVID endgame. So we'll discuss. These are the very frequently asked questions. Kahin bhi jao, everybody is asking. Is there end of this pandemic? What is the role of acquired immunity, vaccination, natural immunity? You also asked this question. Adult vaccination, children vaccination, long-term effect of these vaccines. Which vaccine is the best vaccine? There are, you must be aware, there are 33 vaccines approved by various regulatory authority, and 334 vaccines are in the different phases of the development for one disease. So unprecedented, completely unprecedented vaccine-related research. What is the role of the booster? What is the role of the natural infection? You asked this question, when COVID became the endemic. So all this, this is so what is the real situation as of now? Currently, more than 37 crore cases this world has already reported, and this is the actual reported figure with more than 56 lakh deaths. So these are the reported number as of today morning. And then if you see the total number of cases in the reporting, this world is reporting per day over 30 lakh cases they are reporting. So these are the reported number of cases. Actual number could be several times higher than this, and more than 9,000 deaths per day this world is reporting currently. Last year, when there were 1 lakh cases per day, that was a huge cry that the entire world is reporting 1 lakh cases. Currently, 30 lakh cases per day. And then, so entire world is crippling. Our India is also crippling. This is a very old slide. Just I changed the figures, right? Since last almost 1.5 years, I'm using these slides, and this is my conscious decision to use these slides because of this. Is there end of this pandemic? The answer is always yes. We had several pandemic, but how? I used to say that through herd immunity, and that herd immunity will achieve through either natural infection and vaccination. This I said almost a year ago, in the month of January, February. So I am using same slide. Now I can say based on the current evidences, see, science is evolving. So based on the current evidences, we can say, no, this is not the right. And I will change my statement. I said 1 year ago that both vaccination and natural infection will provide the herd immunity. Why? So the last slide is for that. So this is the situation. COVID, forget about all this. This is the world situation. Currently, this is more than 30 lakh today, as in 30 lakh cases per day, and almost 9,000 deaths per day. So this is the situation. We know vaccines are very effective in preventing many diseases. So vaccine is the really smart way to control diseases. Per year, we are saving more than 3 million, 30 lakhs deaths as per the estimate all over the world. And since last many years, we are using vaccines for the different diseases, especially childhood disease. So we have prevented many deaths, in billions deaths we have prevented till now through the good vaccination program for all the vaccine preventable diseases, especially childhood vaccine. And now we have 33 vaccines for this also. This is the current situation. 334 vaccines are in the different phases. 33 have been approved by the various regulatory authority. So this is the current situation. Majority of these vaccines are of 2 doses, few are 1 dose also. So this is the current situation. And what is the vaccination status? Almost more than 60% of the world population has received at least 1 dose. This is the situation, except African countries. So African countries, overall vaccination status is very low. Overall case status is also low, reporting number, and death is lowest. If you compare with other continent, either it's your Asia or North America, South America, Australia. So overall, deaths are case fatality rate, and case fatality rate is slightly high because of not detecting a lot of asymptomatic cases, etc. So testing is low, but overall death reported are also low. So this is the current situation. Vaccination, we know more than 165 crore we have already inoculated. These are the approved vaccine in India. Covaxin, this AstraZeneca vaccine, here it's a Covishield, Sputnik, Zydus Cadila vaccine. But they're using different platform, like Covaxin is using this platform, whole virion inactivated virus, whereas Sputnik and this Covishield, they are using the vector platform. So the adenovirus vector they are using. So they are different technology. So all these are using different technology. In short, I can say. Covaxin already approved by India, and also WHO has already approved this. So these are the vaccine approved by the WHO. These are the 10 vaccines WHO already approved as of now, as on 30th January 2022. So vaccine effectiveness. Vaccines are effective. During clinical trial, we found that vaccines are effective. No doubt vaccines are effective in preventing severity and death. Although that time, pharmaceutical company, they claim that they are preventing infection. But now we know that vaccines are not preventing infection, but definitely preventing severity and death 80 to 90% in a susceptible population. So here the catch is susceptible population. All these clinical trials were done in the susceptible population, though who never had COVID. So vaccine effectiveness and good vaccine effectiveness, reducing severity. So there are a lot of publications. So vaccine is effective against reducing severity and death 80 to 90% in a susceptible population. This is the message. There are issues related to vaccine. So if you compare, but there are some adverse event following immunization, serious adverse event. But you compare these adverse event with the COVID disease, then it's very low. If a person is developing COVID, then 5 times more chance of having thrombocytopenia than the vaccine. So the disease is definitely causing more problem than the vaccine. This is the message, that all these vaccines are causing some problem, but these problems are very rare. Almost 10, somewhere between 10 to 20 per million. हर 10 लाख में 10 से 20 लोगों को serious adverse event reported है, वो चाहे cardiac inflammatory disease हो, जो messenger RNA vaccine है, or like these vaccines, जो vector platform use कर रहे हैं, like your Sputnik and AstraZeneca vaccine, Covishield. So blood clotting करते हैं, so but very rare. Almost 1 lakh, 1 cases they have reported. So 10 per this. So this is the fact that after this COVID, all these same times of serious adverse event, even after COVID, they are reporting, but and several times higher than the vaccine. But vaccines are also causing some serious adverse event following nation, but these are the rare. But now we know there is no need to show all these publications. All over the world, breakthrough infections are, we have clear definition of breakthrough infection. Breakthrough infection means 2 weeks after the second dose. So almost everywhere, if you see the UK data, daily they are reporting around 1 lakh cases. Till last week, 1 lakh cases, and out of 1 lakh, almost 50 to 60,000 cases are of breakthrough infection. That means fully vaccinated. Even in the UK has inoculated 3rd dose also, so booster, more than 51% in the population, they have received booster also, but breakthrough infection. So message here is that all these vaccines are not preventing infection, they are preventing severity and death in a susceptible population. So breakthrough infection, there are a lot of publication. I'm not going to now, actual data is available, so there is no need to show all these publications. Although Public Health England has released some data on this also. Then effectiveness versus now your natural immunity. There are a lot of publications that natural immunity provide better and longer duration of protection. And this is New England Journal of Medicine. This was published almost a year ago, January 2021. They followed up 12,000 healthcare providers and very well designed. And that's why one of the best journal of this world, New England Journal of Medicine, the impact factor is more than 70. Almost in of all our Indian the journals, impact factor is around 1 only. So very high impact journal, and then but these are not getting place in the media. So somewhere science is not getting place in the media. There are facts about natural infection, there are facts about vaccination also. So we must cover both. That almost out of 12,000, even after 7 months, only 2 developed, and this is a very well-designed study, only 2 developed RT-PCR positivity, and none developed any severity. So the way we calculate the vaccine efficacy, although they have not calculated, I calculate the efficacy of natural infection for preventing infection. Only natural infection, those who recover from, they are preventing infection. After vaccination, it's a wrong notion that they are preventing infection. So it's almost 95%. Even they are preventing infection 95%, and severity almost 100%. Based on this paper conclusion. Then there are many other studies. Some studies have suggested that you may develop lifelong immunity after this natural infection. Like Nature, this is also very high impact journal, that you may develop a lifelong immunity. NEGM study I have already discussed. Even UK released the data. Now reinfections rate are very common after Omicron, because of reason that all these mutations are in the spike protein and mainly in the receptor domain. So after Omicron, reinfections are, so the Omicron is bypassing your existing immunity, either acquired through your vaccine or natural immunity. But the benefit is it's a severity and deaths are almost nil. So just like your vaccine is reducing severity and death, but here almost it's a negligible after natural infection if you are getting second time infection. Just last week, CDC released, first time CDC realized that natural infection is providing better and longer duration of protection. It took almost 2 years to understand this fact to CDC, and they just released this last week. They have, on January 19th, they released this in their report. So we know it's a safe and effective way and clever to control vaccine in a susceptible population. So it prevents severity, hospitalization, and death among susceptible population. I'm not considering those who recovered from the COVID, they are the susceptible population. Effect of transmission on the disease, definitely. Now we are aware that it's very minimal. So even those who are vaccinated, they are transmitting infection. Those who are unvaccinated, there are publications that even viral loads are almost same in both groups. So vaccine is providing individual protection. That severity, chances of severity and death is low in vaccinated group. But at community level, they're not providing. During vaccination continue to be critically important. We have already. Now, at that time, I said, if you recall last year, in your show, Sudeep, documentary coverage should not be the part of priority group. That time I said, we must differ. Now I'm saying, no, this should not be vaccinated. So there is a difference, right? Now there is sufficient evidence that those who recovered from the COVID, they are the best protected person on this earth based on the available researches. So that time I said this should not be priority group. Vaccine is very precious commodity. So we must vaccinate those who never had COVID. And after vaccinating these people, we should give vaccine to those who recovered from the COVID. So exclude them from the priority group. But now I am saying, based on the current evidence, there is no need. So we can say it's a completely irrational if it's not universal vaccination. Now it's the time to use strategic vaccination only. So universal vaccination is completely irrational because it's if saving life and yet those who are use this precious resource in a susceptible population. Those who recover from COVID, they are not the susceptible. So it's a completely irrational. It's unethical also. Why it's unethical? Because see, we know that we are not going to provide additional benefit through the universal vaccination those who recover from the COVID. So then if you are giving vaccine to there are no additional benefit, but there are some adverse event following, although these are the rare, but we are exposing them to a serious adverse event following immunization. And after we have a lot of publications that after COVID, the chances of serious adverse events are more because all these are hyperimmune response. So it's unethical. Knowingly, we are exposing them to at a risk and unscientific also. Agar do group, we know that one group is better protected. So for science, currently we are using 33 vaccine. Long term, किस vaccine का क्या effect होगा? We don't know. So for science also, we must have a comparator group. Those who recover from COVID, we can keep them as a comparator group. कि long term effect, good effect क्या है vaccine का, bad effect क्या है, ये जानने के लिए we must have a comparator group. कल अगर हमें आता है कि no, these people are also at the risk of severity and death. Omicron में infection सबको हो रहा है, so severity and death. So then we can vaccinate. But based on the current evidence, so it's a time to use the current evidences. ठीक है? So all this ये है, ठीक है? This is all about your. I believe in 20 minutes time, I have finished. So
you answered many questions, sir. और सबसे बड़ी बात है कि आपने बहुत ही strong policy recommendation sort of दिया policy makers के लिए particularly.
Yeah.
On one is that policy makers की why we can keep the infected group on hold and give prioritization to those who are more vulnerable and co-virgins who have not been infected.
Yeah.
Yes.
We know science. See, science is evolving. Daily हमने evidence आते हैं. Daily 100 publications, more than 100 publications आ रहे हैं. So we must use. ऐसा नहीं कि जो कल decision लिया उसको हम change नहीं कर सकते. So based on the current evidences, and you asked about the WHO. कि WHO why ignoring? In that statement, I have already mentioned this. See, WHO last year when many these government agencies said that natural infection is protecting, in January 2020, March 2020, they said that no, there is no guarantee of natural immunity. You may get reinfection. So we don't have any evidence because this virus is only 3-month-old virus, right? Then in May 2021, they released their advisory and they said that vaccine, natural infection is also providing immunity just like vaccine. And after recovering of natural infection, those who were unfortunate, they died. In their advisory on the 10th of May 2021, they said that almost 90 to 99% individuals are developing neutralizing antibodies after the natural infection, and it's providing equal protection. Even if though if providing equal protection, but they never said that they do not need vaccination. Right? That time vaccine was a priority for the susceptible population. और हमें पता था कि vaccine is reducing severity and death. So the susceptible population को देने के लिए recommendation होता है. So never they recommended this. Even after this Omicron is escaping your immune mechanism. Both acquired immunity either through vaccination or through natural infection. The very after when 24th of November, South Africa reported to WHO, within 2 days they declared this variant of concern based on two evidence. One, it's a highly infectious, so no doubt it's a very highly infectious, and second, immunity escape mechanism bypassing the existing immunity. So ये था that time, but they also recommended this is possible. See, majority of these vaccines except Covaxin, they are producing antibodies against the spike protein. चाहे all these vaccines, चाहे messenger RNA vaccine हो या vector platform वाले vaccine हो, they are producing antibodies against the this spike protein. If all these mutations are happening in the spike protein, right? इसमें चूंकि ओमिक्रॉन में ज्यादा म्यूटेशंस हुए थे एंड दैट टू इन रिसेप्टर बाइंडिंग डोमेन, इसलिए जो रीइंफेक्शन भी हो रहा है, बट सीवियरिटी और डेथ जो है दोज हु रिकवर्ड फ्रॉम द कोविड उसमें नहीं हो रहा है, क्योंकि आफ्टर नेचुरल इन्फेक्शंस इट्स ए ब्रॉड स्पेक्ट्रम एंटीबॉडीज. सो व्हाई दे नॉट रिकमेंडेड कि जिनको नहीं हुआ उन्हीं को ये करो. हाउ इज दिस गोइंग टू इंप्रूव? ऑल ओवर वर्ल्ड इफ यू सी द डेटा, I mentioned about the CDC data. तो कभी भी तो उनका obsession है about the vaccine साइंस के प्रति ऑब्सेशन नहीं है, इट्स ऑब्सेशन फॉर द वैक्सीन ओनली। WHO का दैट्स व्हाई आई सेड कि यूज द एविडेंसेस। ठीक है, लास्ट ईयर एंड व्हेन दिस वायरस last year first time reported from the US one, that time we didn't have any evidence, that was a completely new virus, तो उस समय speculations ठीक था। But even currently if you are speculating everything at the cost of scientific evidences, so if you are ignoring scientific evidences, that means something is wrong somewhere। तो ये था मेरा कंसर्न, और कुछ नहीं था।
सर बहुत यूजफुल रहा सर। कुछ क्वेश्चंस रह जाते हैं, आगे हम नेक्स्ट अपने डिबेट्स में जारी रखेंगे।
In my talk I covered everything.
You covered everything, but yeah, ending with the last question again, sir, on the endemic part, sir. Does Omicron make this endemic?
ये गवर्न करता है कि हमारी जो है एक्वायर्ड इम्यूनिटी है कितनी सस्टेन कर रही है। सो बेस्ड ऑन द करंट एविडेंसेस ये है कि वैक्सीन इज रिड्यूसिंग सिवियरिटी एंड डेथ, बट वाज अ वेनिंग ऑफ प्रोटेक्शन हो रहा है आफ्टर 6 months, यूजुअली आफ्टर 6 months। दैट्स व्हाई ऑल ओवर वर्ल्ड जो है दे हैव रिकमेंडेड बूस्टर, राइट। बट नेचुरल इन्फेक्शन के बाद अभी वेनिंग नहीं हो रहा है, सो सिवियरिटी एंड डेथ जो है नेचुरल इन्फेक्शन, तो द वे दिस ओमिक्रॉन इज इन्फेक्टिंग पीपल ऑल ओवर वर्ल्ड, नॉट ओनली इन इंडिया। फ्रांस जैसी छोटी कंट्री में रोज 5 लाख हो रहे हैं, 10 लाख यूएस में हो रहे हैं, सो ऑलमोस्ट पूरे वर्ल्ड में मोर देन 30 लाख केसेस। सो द वे इट्स स्प्रेडिंग वेरी फास्ट स्प्रेड हो रहा है, तो ये लग रहा है कि मेजॉरिटी ऑफ पॉपुलेशन विल गेट इन्फेक्शन। एंड बेस्ड ऑन द करंट एविडेंसेस वी कैन से दैट दोज हु रिकवर्ड फ्रॉम द कोविड दे आर द बेस्ट प्रोटेक्टेड पर्सन ऑन दिस अर्थ। इसको देख के लगता है कि टुमारो इन्फेक्शन में आकर कोई नया वेरिएंट आएगा, दिस इज ए आरएनए वायरस, म्यूटेशंस होते रहेंगे, बट इम्पैक्ट विल बी लो। सो अगर पब्लिक हेल्थ प्रॉब्लम नहीं रहते, जस्ट लाइक कॉमन कोल्ड अगर हो रहा है, सो दैट इज वेरी लाइकली कि ये जो है करेगा। एंड बेस्ड ऑन द करंट एविडेंसेस अगर देखो तो दिल्ली में इतनी डेथ्स नहीं हुई या कंट्री में नहीं हुई, क्योंकि व्हेन द सेकेंड वेव केम इन दिस कंट्री, हम जो है सिर्फ एप्पल को एप्पल से ये कर सकते हैं, एप्पल को जो ऑरेंज से कंपेयर नहीं कर सकते। सो ओमिक्रॉन का ओमिक्रॉन से कंपेयर कर सकते हैं, एंड डेल्टा का डेल्टा से। अभी हमने ये भी कंपेयर कर दिया एप्पल को ऑरेंज से, वो हम जो टीचिंग करते हैं वही करते हैं कि डेथ रेट ओमिक्रॉन का यू कैन नॉट कंपेयर विद डेथ रेट ऑफ ये कि वहां उस समय 2% वैक्सीनेशन था, नाउ इट्स 70% वैक्सीनेशन, दैट्स व्हाई वी आर प्रोटेक्टेड। सो वी आर कंपेयरिंग एप्पल विथ ऑरेंजेस, you cannot compare apple, this is the basic principle हमारा इसका होता है एपिडेमियोलॉजी का जो हम पढ़ाते हैं कि you cannot compare apple with oranges, compare apple with so जो एविडेंसेस थे of your natural infection का till now कि बेस्ट प्रोटेक्शन प्रोवाइड कर रहा है। सो जिस तरीके से इन्फेक्शन हुआ है वह जो है लंबे ड्यूरेशन तक प्रोटेक्शन देगा, और तो ये प्रॉब्लम नहीं, सिवियरिटी एंड डेथ नहीं होगी। एंड दिस इज द मेन रीजन जो इस समय सिवियरिटी एंड डेथ कम हो रही है इस कंट्री में, दिस इज द मेन रीजन। वैक्सीन इज आल्सो वेरी इंपॉर्टेंट, बट उन्हें ससेप्टेबल पॉपुलेशन में इससे नहीं बेटर दे रही है। जस्ट आई एम गिविंग वन एग्जांपल, उसको मैंने कई पब्लिकेशंस आ चुकी हैं फ्रॉम दिस योर इजराइल, वन पब्लिकेशन, एंड दे कंपेयर्ड वैक्सीनेटेड ग्रुप फाइजर वैक्सीन के साथ नेचुरली इन्फेक्टेड अनवैक्सीनेटेड ग्रुप, and they found even after 1 year, क्योंकि इन्फेक्शन पहले हुआ था, 1300% better protected those who recovered from the COVID and have not taken vaccine than those who had 2 doses of vaccine. So अगर आप unvaccinated और vaccinated group हो तो definitely vaccinated group better protected है, right? लेकिन अगर आप natural infection versus those who recovered from natural infection and vaccine से करें तो natural infected group is much better protected, क्योंकि मैं even beyond any comparison अगर age adjusted कर लें तो 2700%, it's not 30% 50% जो हम बाकी की बात करते हैं, it's a 2700 better protection from the severity and death if you recovered from the COVID. So these are the evidences, we must use evidences. कल नहीं था बट आज अगर हमारे पास है तो हमें यूज करना चाहिए एंड स्ट्रेटेजिक जो है गाइडलाइंस बनाना चाहिए फॉर दिस। अदरवाइज व्हाट विल हैपन, पीपल विल लूज ट्रस्ट इन वैक्सीन। हम लोग इतनी मेहनत से वैक्सीनेशन अंडर 5 वैक्सीनेशन को बनाए हैं, बट इरेशनल यूज होगा तो पीपल विल लूज द ट्रस्ट इन द वैक्सीनेशन प्रोग्राम, जो मेरे बाकी वैक्सीनेशन प्रोग्राम सफर करेंगे। So thank you very much.
Thank you, sir. The objective of inviting you was the basis that you have always been outspoken on the scientific facts, data-driven policy making, and that is the objective of our show also, Health4All. We promote scientific evidence-based discussion, and that's why we get all the one of the most credible experts on the show from time to time. We are very popular on YouTube and Facebook Live. We are live, and we have got our next session experts, leading gastroenterologists of the country, Dr. Anurag Tandon. I think he has been your ex-colleague also at AIMS. Dr. Sujit Ranjan, a lot of other leading gastroenterologists are on the show. We'll move to the next show, sir. The key message today take is one of the key messages from all the talk discussion we had with Dr. Sanjay Rai, the distinguished epidemiologist, the public health expert, also the president of Indian Public Health Association, sir, is that बहुत ज्यादा डरिए मत. एंडेमिक का मतलब ये होता है कि डिजीज माइल्ड हो जाएगी, डिजीज खत्म नहीं हो जाएगी, डिजीज माइल्ड हो रही है, जिसका साइन ऑलरेडी दिख रहा है. और ओवरऑल सारे प्रिकॉशंस लेते रहिए, बच के रहिए इस कोविड को हमेशा के लिए खत्म करने के लिए. आई विल आस्क माय एडमिनिस्ट्रेटर टू रन द नेक्स्ट सेशन इंट्रो वीडियो and give it over to Mr. Shankar to start the next session. Thank you, Dr. Rai, again. Thank you.
Thank you. And thank you, everybody.
Welcome to session number 2. The topic is gastro, liver, and biliary diseases, causes and prevention. To discuss this, we have with us Dr. Anurag Tandon, a well-known gastroenterologist with clinical experience of over 2 decades. He is currently serving as head gastroenterology and hepatology in Metro Center of Liver Diseases at the Metro Hospitals. He was the recipient of Young Investigator Award at the 10th Asian Pacific Congress of Gastroenterology held at Yokohama in Japan. Dr. Tandon is also the chairman of Digestive Disease Foundation of India. Along with him is Dr. Piyush Ranjan, a distinguished gastroenterologist at the Sir Gangaram Hospital, New Delhi. He is a liver specialist with a keen interest in therapeutic endoscopy and ERCP. He specializes in the treatment of gastrointestinal problems and liver diseases and is an expert in procedures such as colonoscopy, endoscopy, ERCP, endo-ultrasound capsule endoscopy. The next speaker would be Dr. Nishant Nagpal, a senior consultant gastroenterology and hepatology at Fortis Hospital, New Delhi. He is a leading endoscopist who has been practicing in premier hospitals in South Delhi since last 6 years. He has a special interest in advanced endoscopic techniques besides liver diseases, liver transplant, and inflammatory bowel diseases. And the last but not the least, we have Dr. Nitish Pratap, a senior consultant gastroenterologist at KIMS Hospital in Hyderabad. He comes with over 13 years of experience in the field. Over to you, Kishore, for your first round of questions.
Thank you, Mr. Shankar. मेरा पहला सवाल डॉक्टर अनुराग टंडन से है. नमस्कार डॉक्टर साहब.
नमस्कार.
अगर मैं गलत नहीं हूं डॉक्टर साहब, तो आपने मेडिसिन पर ज्यादा निर्भर रहने के बजाय नेचुरल कोर्सेज पर ज्यादा ध्यान देने की बात कही है. आपकी क्या राय है? कोई फिक्स सॉल्यूशन है?
देखिए, किसी भी बीमारी में उसके इलाज के लिए जो रास्ता लिया जाता है उसमें केवल दवा का मार्ग नहीं होता है. कहानी शुरू होती है आदमी के तौर तरीके से और वो अपने आप को किस वातावरण में रख रहा है. इसी को हम लोग कहते हैं लाइफ स्टाइल मॉडिफिकेशंस एंड लाइफ सिचुएशंस. तो जो राय दी जाती है उसमें आपको अपने तौर तरीके सुधारने की राय देना, भोजन पर ध्यान देना, व्यायाम पर ध्यान देना, शारीरिक चुस्ती पर ध्यान देना, इन बातों की भी बहुत अहमियत है, जिसके पहले वो दवाएं जो आप आगे लिखेंगे वो उस एक सेटिंग में काम करेंगी. तो समस्या को देखते हुए एक उचित लाइफस्टाइल और तौर तरीके की राय दी जाती है और फिर ही दवाओं का लाभ मिलता है.
डॉक्टर साहब, हमारा ये शो इस समय दुनिया भर में YouTube और Facebook पर लाइव देखा जा रहा है और काफी लोगों के सवाल भी आ रहे हैं, काफी क्वेश्चंस आ रहे हैं. एक क्वेश्चन आया है रांची झारखंड से मयंक गुप्ता का. वो जानना चाहते हैं कि कुछ डॉक्टर कहते हैं कि जिनको गैस या पेट संबंधित कोई भी प्रॉब्लम है तो दूध या अन्य डेयरी प्रोडक्ट नहीं लेना चाहिए. कुछ डॉक्टर कहते हैं नहीं, इसमें कोई दिक्कत नहीं है. क्या करना चाहिए इस मरीज?
देखिए, कोई भी राय जब दी जाती है तो सारी परिस्थिति समझनी पड़ती है मरीज की, उसके क्या लक्षण हैं, कब से हैं, किस बैकग्राउंड में हैं. लेकिन मोटे तौर पे मॉडर्न मेडिसिन में प्योर मिल्क, दूध को बहुत अच्छा नहीं समझा जाता है. एंड इसका जो कॉन्सेप्ट है वो है लैक्टोज इंटॉलरेंस का. तो हम लोग मोटे तौर पे राय देते हैं कि हर इंसान भोजन वही करेगा जो उसको अपने अनुभव से अनुकूल बैठता है. लेकिन स्पेशली जब डाइजेशन के लक्षण हो, गैस हो, ब्लोटिंग हो, इनडाइजेशन हो, स्टूल्स में समस्या हो, तो कुछ समय प्योर मिल्क रोक दिया जाता है. हमारे यहाँ कर्ड, दही, पनीर, इस सबको अच्छा समझा जाता है. लेकिन होल मिल्क को कई परिस्थितियों में, स्पेशली कई बड़ी आंत की बीमारियां उसके दौरान जब वो एक्टिव होती हैं, तो कुछ समय के लिए पूरे दूध का सेवन को निश्चित रूप से रोकते हैं. तो वैसे तो परिस्थिति को पूरी तरीके से जांच करके समझ करके राय दी जाती है, लेकिन प्योर होल मिल्क जो है कई इंडिविजुअल्स उम्र के साथ टॉलरेट नहीं करते हैं। लेकिन उसी सांस में हम लोग ये बात भी समझाते हैं कि कई ऐसे वृद्धावस्था वाले लोग हैं जो केवल दूध के ऊपर जिंदा है, तो यदि उनको वो माफिक बैठ रहा है, टॉलरेट करते हैं, तो उसमें कोई रोकने की बात नहीं होती है। तो हर सिचुएशन को इंडिविजुअलाइज करना पड़ता है। लेकिन मॉडर्न मेडिसिन में प्योर मिल्क को लेकर के कुछ रिजर्वेशन जरूर है। लैक्टोज इंटॉलरेंस, जो होल मिल्क में प्रोटीन पाया जाता है, उससे कई इंडिविजुअल्स को सेंसिटिविटी होती है। और दूसरी बात कि उम्र के साथ मिल्क को बचाने की जो एंजाइम है उसकी कमी शरीर में होती जाती है।
डॉक्टर टंडन, एक बात देखी गई है खास करके गैस्ट्राइटिस के मरीजों में कि वो खुद डॉक्टर बन जाते हैं, या कोई बगल वाला केमिस्ट होता है उससे पूछ के कोई गोली खा लेते हैं और उनको थोड़ा सा भी कुछ गड़बड़ लगता है तो उनको लगता है कि गैस हो गया। ऐसा कौन सा स्टेज है जब लोगों को ये समझना चाहिए कि नहीं सचमुच में गैस्ट्राइटिस है और ये डॉक्टर से कंसल्ट करने का सही समय है?
देखिए, इस सवाल का जवाब ये है कि एक तो यदि फर्स्ट होम रेमेडीज और सिंपल अप्रोच से परिस्थिति और तकलीफ बनी रहे, इसको कहते हैं परसिस्टिंग सिम्टम्स। भूख लगना कम हो जाए, वजन कम होना लगे और लक्षण आने लगे इन टर्म्स कि आपको पेट में दर्द होने लगे, उल्टी होने लगे, भूख कम होने लगे, तो ये दिख जाता है कि जो भी आप मेजर्स ले रहे हैं, चाहे होम रेमेडीज हैं, चाहे ओवर द काउंटर मेडिसिन है, उससे आपको लाभ नहीं मिल रहा है। दूसरा, बहुत ज्यादा ओवर सेल्फ मेडिकेशन की राय नहीं दी जाती है। देखिए, अपने देश में बड़ी सरलता से आप किसी अच्छे जनरल फिजिशियन से, एक अच्छे फैमिली फिजिशियन से, और यदि जरूरत समझे तो एक सुपर स्पेशलिस्ट से भी मिलने की परिस्थिति बन सकती है। तो बहुत ज्यादा इस समय ऐसी परिस्थिति में विलंब करना उचित नहीं है। दूसरा, यदि आपके और बीमारियां हैं, आप और दवाइयां ले रहे हैं, समझिए शुगर की है, ब्लड प्रेशर की है, हार्ट की है, तो ऐसे में डॉक्टर के पास एहतियातन जल्दी पहुंच जाना ही उचित है, न कि जब बात बहुत बढ़ जाए। और ये अपने देश में एक बहुत बड़ी कमी है कि ज्यादा हम लोग देखते हैं कि मरीज बहुत देरी से आते हैं, तो ऐसे में उनकी मदद करना और कठिन हो जाता है और इलाज भी और पेचीदा और फिर महंगा भी हो जाता है, और फिर कॉम्प्लिकेशन के भी डर इसमें बढ़ते जाते हैं। तो यदि लक्षण बने रहे, एक उम्र है और बीमारियां हैं, तो बेहतर यही है कि आप समय से डॉक्टर से मिल लें ताकि कोई चीज व्यर्थ में छूटे ना और देरी ना हो जाए।
थैंक यू डॉक्टर साहब, आप हमारे साथ बने रहिए, हम फिर लौटेंगे आपके पास, आपसे बहुत जानकारी लेनी है और बहुत अच्छी अच्छी जानकारी आप दे रहे हैं, लोगों को बहुत फायदा हो रहा है और सवाल भी बहुत आ रहे हैं हमारे पास। हम आगे बढ़ते हैं और डॉक्टर पीयूष रंजन से मेरा अगला सवाल है। नमस्कार डॉक्टर साहब। डॉक्टर साहब, आप अनम्यूट कर लीजिए।
नमस्कार
जी, नमस्कार सर। डॉक्टर साहब, एक चीज देखा गया है, कोविड इन्फेक्शन के बाद बहुत लोगों के में लिवर इन्फेक्शन की शिकायत आती है, जीजीटीपी बढ़ गया या एलटी रेशियो बढ़ गया, इस तरह के कई समस्याएं आती है। क्या इसकी कोई और वजह है या कोविड रिलेटेड प्रॉब्लम है?
देखिए, एसजीओटी एसजीपीटी बढ़ना लिवर में इन्फ्लेमेशन का इंडिकेटर होता है। ये मल्टीपल रीजन से हो सकता है। तो जब भी एसजीओटी एसजीपीटी बढ़ा होता है, आप एक तो बैकग्राउंड हिस्ट्री देखते हैं कि क्या ये इंसान पहले अल्कोहल लेता था। दूसरे कारण हेपेटाइटिस बी सी, जो कॉमनेस्ट रीजंस होंगे। कोविड स्पेसिफिक अगर हम देखें तो दो इश्यूज होती हैं कि जैसे कोविड एक तरह का वायरस है, किसी भी वायरल इन्फेक्शन में, जैसे डेंगू में एसजीओटी एसजीपीटी बढ़ जाता है, तो कोविड में भी एसजीओटी एसजीपीटी बढ़ जाता है। और ये देखा गया है कि ये जो ACE2 रिसेप्टर्स होते हैं जिसके जरिए ये लंग में घुसता है, ये ACE2 रिसेप्टर्स इंटेस्टाइन में, बिलियरी सिस्टम में, पैंक्रियाज में, लिवर में, हर जगह होते हैं। तो एक कारण वो होता है। दूसरा, ड्रग इंड्यूस्ड जो काफी सारी दवाइयां यूज की जाती हैं, खास करके इसमें रेमडेसिविर हेपेटोटॉक्सिक मेडिसिन एक तरह से होती है। तो एक डेफिनेट लेवल से अगर एसजीओटी एसजीपीटी बढ़ा हो तो रेमडेसिविर यूज करना मुश्किल होता है, और जब हम रेमडेसिविर यूज करते हैं तो एसजीओटी एसजीपीटी को मॉनिटर करते हैं। और इसी तरह से और भी मल्टीपल मेडिकेशंस होती हैं जिसके कारण एसजीओटी एसजीपीटी बढ़ जाता है। अगर ये एक निश्चित लेवल से ज्यादा नहीं बढ़ा है तो ये ज्यादा चिंताजनक बात नहीं है। अगर ये कोविड रिलेटेड है, टाइम के साथ ये नॉर्मल आ जाएगा।
डॉक्टर साहब, गैस्ट्राइटिस के बारे में एक बात देखी गई है, कई लोगों में ये देखा गया है कि जब अटैक होता है गैस्ट्राइटिस का, तो वो इतने बेचैन हो जाते हैं कि कई बार ऐसा लगता है कि जैसे उनको मतलब वो बेहोश तक हो जाते हैं, बेहोशी की हालत हो जाती है। क्या ये ऐसा गैस्ट्राइटिस में आम है या रेयर है या किसी और वजह से भी हो रहा है?
देखिए, सबसे पहले चूंकि ये लाइफस्टाइल रिलेटेड गैस्ट्रोइंटेस्टिनल डिसऑर्डर्स पर हम बात कर रहे हैं, तो मैं आपको बताऊं कि गैस्ट्राइटिस अपने आप में एक कोई पर्टिकुलर बीमारी नहीं होती है। एक तरह का गैस्ट्राइटिस एक तरह का एक वेग टर्म है जो बहुत सारी चीजों के लिए लोग इस्तेमाल करते हैं। तो जैसा कि डॉक्टर अनुराग ने कहा, सबसे पहले ये समझने की जरूरत है सिम्टम्स के जरिए कि इंसान को हो क्या रहा है। गैस्ट्राइटिस मतलब स्टमक का इन्फ्लेमेशन। गैस्ट्राइटिस के सिम्टम्स पेट की ब्लोटिंग, डकारे आना, चेस्ट में बर्निंग, वॉमिटिंग, ये हो सकता है, बट गैस्ट्राइटिस के कारण पर से एज सच बेहोशी नहीं होगी। गैस्ट्राइटिस कई बार इस तरह की चीजें हिस्टेरिकल सिम्टम्स के साथ जुड़ी होती हैं। एक तरह की कहीं सुनी बातें होती हैं, जैसे आप जब इस तरह की बातचीत चल रही है, बहुत सारे लोगों से आप सुनेंगे कि हम अपने शोल्डर को प्रेस करते हैं, कंधे को प्रेस करते हैं तो डकार आती है। इस तरह की बातें लोग लर्नड बिहेवियर होता है, किसी ने बता दिया, उन्होंने समझ लिया और ये हो गया। आमतौर पर अगर आप इनको देखें तो ज्यादातर ये ऐसे लोग होते हैं जो टाइम से खाना नहीं खाते, काफी लंबे टाइम तक भूखे पेट रहते हैं। अगर किसी को वाकई बेहोशी हो गई, हो सकता है शुगर की कमी हो रही है, कोई और रीजन हो, बट ज्यादातर इस तरह की चीजों में हिस्टेरिकल होगा। बट हैविंग सेड दैट, अगर कोई बेहोश हो रहा है तो उसको देखने की जरूरत है। देखिए, मेडिसिन जो है ये प्रोबेबिलिटीज पर चलता है और इसमें मल्टीपल चीजें हो सकती हैं। तो मेरे सारे जो डिस्टिंग्विश्ड पैनलिस्ट्स हैं ये एग्री करेंगे कि जैसे किसी को पेट में दर्द हो रहा है और बेहोश हो रहा है, तो इतनी सारी बीमारियां दूसरी और हो सकती हैं, है ना। जैसे मैं अगर बात करूं, पोर्फायरिया है बीमारी जो पहली बार दिमाग में आएगी, लेड, बहुत सारी बीमारियां, ये बहुत अनकॉमन बीमारियां हैं। बट गैस्ट्राइटिस पर से और कोई बार बार बेहोश हो रहा है तो ये यूजुअली फंक्शनल डिसऑर्डर्स की कैटेगरी में आता है, जो कि एक तरह का मन की समस्याओं से जुड़ी हुई चीजें होती है। पेट की कई सारी बीमारियां साइकोसोमैटिक डिसऑर्डर्स के साथ एसोसिएटेड होती हैं, तो ये उसका पार्ट हो सकता है।
और कई बार ऐसा भी देखा गया है कि खाना खाने के बाद लोगों को लगता है कि जैसे उनका फूड पाइप में खाना फंस गया हो, और ये काफी देर तक, घंटों बाद तक भी लगा रहता है। ये भी क्या कोई सिम्टम है?
बिल्कुल। देखिए, खाना ऊपर आने का सेंसेशन होना, यानी डकार आना, चेस्ट में बर्निंग होना, ये गर्ड यानी कि गैस्ट्रोइसोफेजियल रिफ्लक्स डिजीज का है, जो कि अगर हम स्टमक और इसोफेगस के बीमारियों के बारे में देखें, सबसे कॉमन लाइफस्टाइल एसोसिएटेड डिसऑर्डर है, जो कि खाना टाइम से नहीं खाना, देर तक भूखे पेट रहना, स्पाइसी फूड खाना, रात को बहुत लेट खाना, ये बहुत सारी लाइफस्टाइल सिचुएशंस हैं जिसके कारण ये इंसिडेंस इस चीज की बढ़ रही है। ये वेस्टर्नाइजेशन का रिजल्ट है। वेस्टर्नाइजेशन ना कहें, ये मतलब खाने पीने की हमारी दिनचर्या के इरेगुलर होने का रिजल्ट है। खाना अटकने का जब भी सेंसेशन होता है, डिस्फेजिया, यानी कि अगर हम ये फील करें कि सॉलिड फूड हम निगल नहीं पा रहे हैं या लिक्विड भी नहीं निगल पा रहे हैं, तो ये एक, जो डॉक्टर अनुराग ने मेंशन किया, ये एक रेड फ्लैग साइन है, ये हमेशा ध्यान में रखना चाहिए। फूड पाइप में किसी प्रकार की अगर रुकावट बन रही है, अगर लंबे टाइम तक एसिड आने के कारण फूड पाइप में स्ट्रिक्चर हो सकता है। दूसरी बीमारियां होती हैं, एक्लेजिया है, फूड पाइप का कैंसर। तो जब भी अगर खाना निगलने में रुक रहा हो तो एक अलार्म सिम्टम है, डॉक्टर को कंसल्ट करें और इसको देखें। कई सारी और बीमारियां होती है जिसमें ऐसा होता है। कॉमन रिफ्लक्स में होता है ऐसा, कई बार ये फीलिंग होती है, इओसिनोफिलिक इसोफेजाइटिस, बहुत सारी बीमारियां हैं जिसमें ये सिम्टम्स होते हैं। तो एक सिम्टम के पीछे आपको उसका बैकग्राउंड देखना है, ड्यूरेशन देखना है, और एसोसिएटेड सिम्टम्स क्या देखना है, वेट लॉस, वॉमिटिंग, ये सारी चीजें देख करके आप डिसाइड करते हैं कि हम इसको आगे कैसे अप्रोच करेंगे।
थैंक यू डॉक्टर साहब, थैंक यू। आप मेरा रिक्वेस्ट है आपसे, आप बने रहिए, हम फिर लौटेंगे आपके पास। ओवर टू यू मिस्टर शंकर।
Thank you, Kishore. We now go to the second panel of doctors. I think I have got a lot of questions to ask, and I'll shoot the first question to Dr. Nishant Nagpal. What percentage of chronic liver diseases are alcoholic and non-alcoholic, and what's the etiological difference between the two? Dr. Nishant, please unmute yourself, sir.
Hi, good morning, everyone. Yeah. if we say that there are 5 most common causes of liver disease, if I properly say that liver disease most common causes, then most common causes are alcoholic liver disease, hepatitis C is the most common cause of liver disease, then alcoholic, then non-alcoholic fatty liver, then hepatitis B, and then autoimmune diseases. These 5 constitute the most important and most common causes of liver diseases. So alcoholic liver disease, if we say, then that depends upon your alcohol intake. There is a rise, significant rise of non-alcoholic fatty liver disease now in this country. There was a recent data which was published from ILBS that they did a school survey of patients in children in New Delhi, South Delhi schools. And it was amazing to find that they found that 70% of the children in schools have non-alcoholic fatty liver disease now in South Delhi. That's a huge number. If we talk about alcohol, then we usually say that each whiskey 30 ml is equivalent to 10 grams of alcohol. So if we say anybody takes 3 to 5 pegs or 30 to 50 grams of alcohol per week, if they take more than that, and if they have any fatty liver disease or liver disease, we talk it as it is alcoholic liver disease. तो अगर कोई एक हफ्ते में 5 पेग 6 पेग्स ज्यादा ले रहा है अपने विस्की के और उसको लिवर डिजीज है, तो उस इंसान को अल्कोहलिक लिवर डिजीज है. But now, as I said, there is definitely a significant rise of people who have fatty liver disease. आज कोई भी अपना अल्ट्रासाउंड करवाने जा रहा है तो उसको भी fatty liver disease है. So there is already fatty liver disease. Alcohol adds to a second hit and it leads to progression of liver disease. There is no way you can definitely say कि इतना नहीं और इतना ज़्यादा. And as far as females are concerned, the dose of alcohol to cause liver disease is exactly half. So the females are even more prone for alcoholic liver disease at even the half dose than this.
So now, are diabetic patients more prone to fatty liver? And if so, in the current pandemic, we saw a rise in diabetic patients due to steroid-induced diabetes, we call it. Did they also witness a fatty liver episode?
There are 2 things I'll again say. See, the prevalence of diabetes in Delhi or in India, if we talk about, then 3 cities, I'll give you metro cities an example. Like Chennai, the prevalence is around 34%. Jaipur, highest currently in India, if the latest census which was shared, then Jaipur, the prevalence is around 35%. 35% of population is already having diabetes. Delhi, 30%. So if we are talking of already 1/3 of your population is diabetic right now. So if they are already diabetic, they are manifested diabetic. So many will be pre-diabetic. Now, any small amount of weight increase or this lockdown, lack of exercise, people have been sitting in home, work from home, eating more, or people have started gaining weight. So that is one reason. These medicines, as you rightly said, that received a lot of steroids. So whatever was just at borderline started manifesting, and these people are diabetics now. Now, those all who are diabetics, 40% of them have non-alcoholic fatty liver disease. That is called NASH, non-alcoholic steatohepatitis. And there is insulin resistance, and that leads to further deposition of triglycerides inside the liver. The fat which is deposited in the liver is triglycerides, not the LDL. So the triglyceride deposition in the liver, and there is a rise in people who have non-alcoholic steatohepatitis. So 40% of diabetics. If 30% of the population is having it, then the 40% of that population is also having associated liver disease. So this is a common thing called metabolic syndrome. It's the disease which is there right now. In this, we have mild diabetes, we have triglycerides or dyslipidemia, we have waist more than 88 centimeter in males and 84 in females, we have hypertension, and it has also said that if these patients are looked at, you will find that these people, out of which 40% people also have liver disease. So it is not uncommon, you have to find it, and this liver disease remains silent till one level. It doesn't even come to know until you look for it and find for it and treat it. And believe me, the most important fact is, जो आपकी show का first question था, the best treatment is lifestyle measures. You have to lose weight, you have to exercise, and you have to eat less. You have to do all these things. Just by eating less, just by exercise, you are not going to lose your weight.
What are the chronic liver diseases that can be effectively treated with liver transplant, and what is the success rate?
Sir, all liver diseases can be treated with liver transplant. See, you have a chronic ka matlab purani liver disease. See, understand some point that for every disease there is a compensated phase, there is a decompensated phase. हर बीमारी कोई भी चीज की हो तो पहले एक फेज है, जैसे मैं इसका एग्जांपल अपने हाथ से लेता हूँ कि मेरा हाथ आग में गया तो सूजेगा, ठीक होगा तो सिकुड़ेगा. Now, even if this hand is become like this, but I'm able to write, I'm able to do my procedures, then it's not that this hand is normal. तो जब हम अल्कोहल पी के अपने लिवर को तोड़ रहे हैं, उसके अंदर थोड़ी सी फाइब्रोसिस कर रहे हैं, उसमें थोड़ा कर रहे हैं, मैंने छोड़ दी, अब मेरी लिवर रिपोर्ट्स ठीक हो गई, तो have you become absolutely normal? No, you have damaged yourself slightly, but that liver is working well. But once you keep on doing this similar damage more and more, that becomes to that level that now I can't work. This is decompensation. So liver disease की decompensation हम तब कहते हैं जब आपको persistent jaundice रह रहा है, आपके पेट में पानी भर गया, पेट के पानी का इन्फेक्शन हो गया, आपको खून की उल्टी हो गई, या आपको इसकी वजह से किडनी का फेलियर हो गया, या आपको बेहोशी रहने लग गई, एंसेफेलोपैथी रहने लग गई. So if you have any of those, then definitely you have decompensation. And once you decompensate, you have an indication to transplant. तो ये लिवर का फंक्शनल काम या प्रेशर वाला काम दोनों खराब हो गया, इसकी वजह से ऐसा हुआ. अब आपने ट्रांसप्लांट किया तो आपने किसी और का लिवर लेके वहां लगा दिया. So whatever your liver problem was, you have corrected it and the patient will become normal. So if we talk about at our center in Fortis Scotch, we do the transplant team does around 20 transplants in a month. So if we are doing 20 in a month, we have a success rate of more than 94%. And we have patients under, I have my patients under follow-up for more than 11 years, and God's grace, they have been doing absolutely fine.
And I'll come back to you, Dr. Nishant. My next question is Dr. Nitesh. Dr. Nitesh.
Good morning.
Good morning. Good morning. Fat, fertile female of 40 is the saying about Gall Stones. Can you elaborate on this?
Sir, Gall Stones is one of the very common problems we see. Many people, there are two subgroup of people जो हम normally देखते हैं. एक सबग्रुप वो होता है कि भाई उन्होंने गए अल्ट्रासाउंड कराने और उनको स्टोन मिल गया. They come to us without any symptoms. Second group is that patient जिनको severe pain होता है and they come to us with a symptomatic gallstones. Now the approach इसका जो gallstone का है, जो हम मतलब आप जो मैनेजमेंट लेके चलते हैं कि अगर पेशेंट को दर्द हो गया तो उसमें तो हम डायरेक्ट एडवाइस करते हैं कि भाई आप गाल ब्लैडर सर्जरी कराइए. आजकल तो इट्स लैप्रोस्कोपिक सर्जरी कॉल्ड लैप्रोस्कोपिक कोलिसिस्टेक्टमी, जिसमें हम गाल ब्लैडर निकाल देते हैं. बट द मेजर दूसरा ग्रुप रहता है जिसको एसिम्प्टोमेटिक होता है. ये इसमें क्या है कि द थॉट इज डिफरेंट इन नॉर्थ एंड साउथ, because north mein there is an increased incidence of gallbladder cancer, so there are more aggressive. In South India we see a little less incidence of jo gallbladder ka cancer hai, so we keep these patients under follow up. So hamara jo approach rehta hai, I agree with those three are the risk factors for gallbladder, magar jo hamara management rehta hai mainly jo hamare symptoms pe rehta hai. ये जैसा अभी सर फर्स्ट क्वेश्चन पूछा था कि भाई किसी को इतना सिवियर पेन होता है कि उसको चक्कर आके गिर जा रहा है. ऐसे पेन में हम कभी गाल ब्लैडर में जो होता है इट्स अ वेरी सिवियर पेन जो यूजुअली रात में आता है, 2-3 बजे 2 से 3 घंटे लगता है, नॉर्मली फैटी फूड से आता है. और ये पेशेंट्स को रात में इंजेक्शंस या दे हैव टू टेक सम मेडिकेशन. तो ऐसे जब सिम्टम्स आते हैं गाल ब्लैडर स्टोन में, तो देन यू विल हैव टू गो फॉर अ सर्जिकल आउटकम.
Now, doctor, we have seen that it's now established that H. pylori causes peptic ulcers. But can stress aggravate the situation? If so, what's the connection?
Yes, sir. Now, if you see our data, what we are talking about is acidity.
Yeah.
If you are seeing an acidity, if I break up the causes of acidity, less than 1% will be because of cancer. Around 20% will be because of an ulceration. 60% will be because of functional causes. Functional matlab stress aa gaya sir. H. pylori is endemic in India.
अगर आप वेस्टर्न डेटा लें तो H. pylori वहां उनके 5 to 10% में होगा, पर अपने पास जो डेटा है it is around 80 to 90%. So the guidelines for treatment of H. pylori in Western countries and Indian are different. इनफैक्ट हम उनको ट्रीट करते हैं भाई जिसको अल्सर है या उनको जिसको डिस्पेप्सिया है और हमें कोई कारण नहीं मिल रहा है. These are the patients जिसको हम ट्रीट करते हैं. But stress is the most important thing because the major chunk of acidity जो हम देखते हैं is what we call as functional dyspepsia. मतलब हमारे ओपी में जो हम देखते हैं 50 to 60% जो हमारा पॉपुलेशन जो आता है विद एसिडिटी में फंक्शनल डिस्पेप्सिया होता है. इसमें मेन जो 3 चीज जो मुझे लगता है इज द डाइट, नंबर 2 इज वेरी इंपॉर्टेंट इज स्ट्रेस, एंड नंबर 3 इज अदर लाइफस्टाइल लाइक वेट एंड द मेडिकेशंस. स्पेशली मेनी पीपल टेक ओवर द काउंटर पेन किलर्स, NSAIDs जो हम बोलते हैं, ये सब आर मेजर कॉजेज जिससे ये बढ़ता है.
Now, is occult blood a sign of cancer or intestinal bleeding, and how do you make out the difference?
So basically, you have to go in this with 3 things. In a patient, agar suppose कीजिए he is aged more than 45 years, if he is having a weight loss, if he is having motion में changes, पे अभी तक 45 years से पहले उनको कोई दिक्कत नहीं थी मोशन पास करने में, अब उनको कॉन्स्टिपेशन हो रहा है, ऐसे पेशेंट में अगर आपको, because you can't take stool focal blood only as a thing, you have to take the patient as a total. तो एज मोर देन 45 हो गई, अगर बिल्कुल भूख कम हो गई है, मोशन में चेंज हो गया है, जैसे सपोज कीजिए इनका मोशन में ब्लड आ रहा है, दे आर बिकमिंग कॉन्स्टिपेटेड और इनको ब्लड ऑफ स्टूल फोकल ब्लड पॉजिटिव आता है, ये पेशेंट्स ऐसे हैं कि भाई इसमें पूरों में रेड फ्लैग साइंस है. दिस इज व्हाट वी कॉल एज अलार्म फीचर. These are those patients जिनको आपको immediate, they have to go to the hospital and work up. वर्कअप में हम क्या करते हैं ऐसे पेशेंट में जिसको ओकल्ट ब्लड पॉजिटिव होता है और ये चेंजेस होते हैं, हम इनको करते हैं भाई पहले तो हम एक बेसिकली हीमोग्लोबिन करते हैं कि भाई हीमोग्लोबिन कितना ड्रॉप हुआ है, कि आपको ब्लड कम हुआ है या नहीं. एक अल्ट्रासाउंड करते हैं देखने के लिए कि और कहीं तो कुछ ग्लैंड्स तो नहीं है, और मेन जो हम एक करते हैं इसमें करते हैं हम कोलोनोस्कोपी, जिसमें हम मोशन के रास्ते ट्यूब डाल के बड़ी आंत की जांच करते हैं, ये देखने के लिए कि अल्सर है या कैंसर है या वो क्या रीजन है जिससे ये हो रहा है. So if a person is having stool focal blood positive, he should be worked up, and अगर उनको ये other red flag signs है, he requires an investigation proper.
Now, is are liver diseases hereditary?
Sir, few of them are there, like hemochromatosis, few are there, but the major chunk of liver diseases जो हम हमारे regular practice में देखते हैं वो है alcoholic. Second, अभी जो major हम देख रहे हैं is because of लाइफस्टाइल की तरफ से, दैट इज ओबेसिटी, दैट इज नॉन अल्कोहलिक फैटी लिवर डिजीज, और थर्ड ग्रुप में आता है वायरल डिजीजेस लाइक हेपेटाइटिस बी, हेपेटाइटिस सी.
I'll come back to you again, Doctor. Now I'll just get back to Dr. Nishant. Dr. Nishant, can you enlighten us on what are the about liver diseases in children? Please unmute yourself, Dr. Nishant.
Sir, liver diseases in children, as you said, the things are like there are, if we are talking of a child, now the child will not have one subset which we call as alcoholic. Usually the child will not be consuming alcohol. So we have diseases which can be, as sir said, that chronic hepatitis kind of illnesses, that is because of viruses going in, which have acute, chronic. If we are talking of acute injury, then acute disease of children can be any inflammation. Itis is inflammation, any inflammation of the liver. That can happen with any illness. You can have typhoid, you can have dengue, you can have anything, and you can have deranged liver enzymes in these patients, in these children. Then comes chronic illnesses. In chronic, if they are talking of inflammation, then we'll talk about hepatitis B and C in these children. Now, hepatitis B in a child, hepatitis B is transmitted through infected blood or through sexual contact. So now if you're talking of hepatitis B in children, then we'll be talking of that they will be getting their hepatitis B from their mother or from family members during birth or anything. But currently, if we talk of, we have got hepatitis B vaccination in a part of, as a part of our immunization program. So the child or people who are born now, they are usually screened. Every pregnancy is screened for hepatitis B. And if a mother is positive, then the child is given immunoglobulin as well as vaccination just at birth, and they are prevented from getting hepatitis B. Hepatitis C very rarely manifests in child. It is again a bloodborne infection. And the treatment also, we do it only if it is very significant, else we allow the child to become bigger, because hepatitis C very slowly causes cancer.
Yeah.
There are certain malignancies which can be common in children. But as I was telling you, that lifestyle diseases have become very common now. That even in children, that the obesity is increasing. Every child now, each things are online gaming, online playings, and less of field and field work. So each and every child is also developing fatty liver, non-alcoholic fatty liver disease. And sooner or later, this also has a very slow progression. And when these children will be becoming adults, they will definitely have liver diseases, and we're going to see a rise in liver diseases until we look at that right now. So we should take care of the health, diet, and exercise of child, and avoid or prevent happy liver, or prevent liver disease from happening.
Thank you. Over to you, Kishore, for your next round of questions.
Thank you, Mr. Shankar. Dr. Anurag Tandon, सर
जी,
एक सवाल बार बार पूछा जाता है और लोगों को जानना भी चाहिए कि गैस्ट्राइटिस की वजह से सीने में तेज दर्द होता है कई बार, और लोगों को लगता है कि यह हार्ट अटैक है, और कई बार ऐसा भी होता है कि उनको हार्ट अटैक का दर्द होता है, लोग समझते हैं कि गैस है और डॉक्टर गूगल से वो दवा पूछ के और खा लेते हैं। आप हमारे दर्शकों को बताइए कि दोनों में वो कैसे अंतर करें।
देखिए, अभी डॉक्टर पीयूष ने इस बात को बताया कि कई बारी जब ये छाती में इस तरीके से तकलीफ महसूस होती है, तो इसमें पेट की बीमारियां और फूड पाइप की बीमारियों की बात आती है। फूड पाइप से संबंधित जो छाती में दर्द उठता है, उसका नाम ही हार्ट बर्न बताया गया हमारे, हार्ट बर्न। दैट मीन्स इट कैन मिमिक सिम्टम्स ऑफ हार्ट डिजीज। जो भी लक्षण हमारे यहाँ हम लोग इंटरप्रेट करते हैं, वो एक सेटिंग में करते हैं। अब किसी के पास बैकग्राउंड है ब्लड प्रेशर की, डायबिटीज की है, उसके साथ उसको छाती में या कहीं भी अपर चेस्ट में वो हाथ रखता है, तो one has to interpret very cautiously. आजकल the tools are very simple. आपका मरीज ऐसा अगर आता है, आपने एक ECG कर लिया, बहुत जानकारी मिल जाती है। आपने पल्स की रिदम देख ली, आजकल इको भी बहुत जल्दी अवेलेबल हो जाता है। तो अप्रोच तो देखिए ये है कि एक केयरफुल हिस्ट्री लेकर के one should err on the side of precaution. हमारा अस्पताल तो विशेष रूप से हार्ट और हार्ट का बड़ा विख्यात अस्पताल है, तो अक्सर हमारे यहाँ इस तरीके के आते हैं, बल्कि कई एस्टैब्लिश्ड मरीज जिनके प्रीवियस हार्ट डिजीज है वो इस तरीके से आते हैं। तो फर्स्ट वर्कअप एक सेटिंग देख करके प्रिकॉशनरी होना चाहिए, जिसमें एक अगर अच्छा हिस्ट्री टेकिंग हो जाए और वाइटल्स के मेजरमेंट हो जाए, ECG हो जाए, तो अक्सर ये बात उस समय क्लैरिफाई हो जाती है। दूसरा, कई बार इस प्रकार के लक्षण होते हैं उन लोगों में जिनको पहले से ही पेट की तकलीफें चल रही हैं, वो फॉलो अप पेशेंट्स होते हैं। तो आप अपने मरीज को जानते हैं, लेकिन जैसा मैंने कहा कि ये चीज अनिवार्य है कि अगर कोई भी लक्षण एक हद के बियॉन्ड बना रहे, तो उसको कोई लेबल देकर के नहीं है तो गैस है छोड़ दिया जाए। आपको मैं बताऊं, मेरे साथ ये हो चुका है कि एक डॉक्टर के ही रिलेशन और दूर से फोन पे बातचीत हो रही कि छाती में दर्द है, छाती में दर्द है, और गैस करके इलाज चल रहा था, एंड ही पास्ड अवे ऑन द टेबल ऑफ अ कंसल्टेंट डॉक्टर विद अ हार्ट अटैक, और सवेरे से शाम तक गैस चल रही थी खाली। तो इसलिए परिस्थिति अनुसार इस चीज को कायदे से इवैल्यूएट करा लिया जाए, वही चीज उचित है। अक्सर ये बात क्लियरली आप घर पे नहीं तय कर पाएंगे कि ये सब हार्ट के लक्षण हैं कि ये पेट से संबंधित है। तो बहुत प्रिकॉशनरी अप्रोच लेना चाहिए, जैसे मैंने बताया।
डॉक्टर साहब, एक आखिरी सवाल आपसे। एक मरीज और एक स्वस्थ आदमी दोनों के लिए वन लाइनर मैसेज आपका क्या है प्रिवेंशन के लिए इस तरह की बीमारियों?
वन लाइनर, देखिए आज गांधी जी की जयंती है, तो जो गांधी जी के प्रिंसिपल्स थे गुड हेल्थ और स्वास्थ्य को लेकर के, मेरी मैसेज वही है कि यदि आप अपने शरीर के ऊपर समय दे रहे हैं, यदि आप व्यायाम में विश्वास करते हैं, अपने भोजन पे कंट्रोल रखते हैं, अपने तौर तरीके अंकुश में रखते हैं, स्ट्रेस फ्री रहते हैं, एक साउंड स्लीप लेते हैं, तो यही जो है अच्छे स्वास्थ्य के मूल बातें हैं। और बाकी आजकल लोगों को 1000 टेस्ट करा लीजिए, अल्ट्रासाउंड कर लीजिए, एंडोस्कोपी कर लीजिए, लेकिन जो पहला कदम उठाना है वो करने में उचित नहीं है। आपने कहा एक लाइन था, तो मेरी यही अपने श्रोताओं से निवेदन रहेगी कि अगर कोविड के पिछले 2.25 सालों ने कुछ सिखाया है तो वो यही है कि यदि इंसान अपने स्वास्थ्य के प्रति जागरूक है तो वो काफी बीमारियों से और तकलीफों से बच सकता है।
थैंक यू डॉक्टर साहब, आपने गांधी जी की पुण्यतिथि पर आपने एक संदेश दिया गांधी जी के संदर्भ में। थैंक यू, बहुत बहुत धन्यवाद। डॉक्टर पीयूष रंजन, कोरोना के शिकार लोगों में देखा गया है, काफी लोगों में देखा गया, मैं बहुतों को जानता हूं जिनको हुआ है, कि ठीक हो जाने का नेगेटिव होने के बाद भी काफी दिनों तक वो लूज मोशन के शिकार रहते हैं। क्या ये कोविड इन्फेक्शन का असर है या कोई और वजह? जबकि मैंने कई लोगों ने देखा कि उन्होंने डोलो के अलावा और कुछ नहीं खाया।
देखिए, जैसा मैंने बताया, इंटेस्टाइन में भी ये ACE2 रिसेप्टर्स होते हैं जिससे पे कोविड आता है। जो जब डेल्टा की बात हो रही थी तो नियरली 20% लोग प्राइमरी सिम्टम डायरिया के साथ प्रेजेंट कर रहे होते थे। ये नोन फैक्ट है। दूसरी चीज है, ये चीज प्रोलॉन्ग्ड हो सकती है। जब भी एक बार डायरिया होता है किसी भी कारण से, तो कई बार इंटेस्टाइन की इरिटेबिलिटी से ये सिम्टम्स परसिस्ट करते हैं, जो पोस्ट इन्फेक्शियस इरिटेबल बाउल सिंड्रोम होता है, यानी कि इंटेस्टाइन की मूवमेंट इम्प्रॉपर होने से ये मोशन बार बार आ सकता है। दूसरा जो कोविड से रिलेटेड ज्यादा यूजुअल चीज है कि एंटीबायोटिक्स, लोग बहुत प्रोफिलैक्टिकली हुआ नहीं और एंटीबायोटिक लेनी शुरू कर दी। थैंकफुली अब ये जैसे जैसे इसके बारे में समझ में आने लगा है। अदरवाइज जब 2020 की बात करें, एजिथ्रोमाइसिन और सारी तमाम एंटीबायोटिक्स लोग बिना किसी डॉक्टर की सलाह के भी लोग ले रहे थे। व्हाट्सएप पे ये मैसेजेस घूम रहे थे कि ये दवाइयों का लिस्ट है, ये लेना शुरू कर दें। तो उसमें जो होता है ये एंटीबायोटिक एसोसिएटेड डायरिया, ये काफी ज्यादा इंसिडेंस इसका बढ़ा है सेल्फ मेडिकेशन से, या जब मेडिसिन दी भी गई लोगों को, कारण जब उचित था तब भी, उसके बाद एंटीबायोटिक्स लेने से हमारे इंटेस्टाइन का जो नॉर्मल बैक्टीरियल फ्लोरा होता है वो सप्रेस हो जाता है और जो हार्मफुल बैक्टीरिया होते हैं वो मल्टीप्लाई करते हैं। तो एंटीबायोटिक्स लेने के बाद कई बार ये डायरिया होता है जिसको एंटीबायोटिक एसोसिएटेड डायरिया कहते हैं। इसी का एक रूप सी डिफिसिल डायरिया होता है, सूडोमेम्ब्रेनस कोलाइटिस, जिसमें एक सी डिफिसिल नाम का बैक्टीरिया बढ़ जाता है। तो कोविड के बाद आई एम श्योर मेरे बाकी सारे पैनलिस्ट भी इससे एग्री करेंगे कि हमने ये पेशेंट्स बहुत देखे। सी डिफिसिल डायरिया जितना मैंने देखा अभी, उतना मैंने पहले कभी नहीं देखा। ये एक वेस्टर्न वर्ल्ड में कॉमन होने वाली डिजीज थी। इंडियंस की इंटेस्टिनल बैक्टीरियल फ्लोरा डिफरेंट है। सी डिफिसिल डायरिया हम लोगों ने काफी ज्यादा देखा है, ये कोविड के बाद है। तो ये
तो इसका क्या उपचार है? या चाहे वो एंटीबायोटिक एसोसिएटेड डायरिया हो या दूसरी तरह का, इसका क्या हो, अपने आप ठीक हो जाता है ये?
देखिए, जो पोस्ट इन्फेक्शियस IBS होता है, तो जहां आपका पहला सवाल था कि दूध से होता है, तो ये जनरली एक लैक्टोज इंटॉलरेंस का कंपोनेंट होता है। आप अपना डाइट थोड़ा मॉडिफाई करें, कुछ सिम्टोमेटिक दवाइयां लें, ये ठीक हो जाएगा जनरली। कुछ सिम्टोमेटिक दवाइयां इंटेस्टाइनल मूवमेंट कम करने के लिए। एंटीबायोटिक एसोसिएटेड डायरिया साथ में अगर हम इनिशियली प्रोबायोटिक्स लेना शुरू करें, उसके साथ ठीक होता है। सी डिफिसिल डायरिया जब होता है तो उसके लिए निश्चित रूप से हमें किसी तरह की स्पेसिफिक ट्रीटमेट की जरूरत पड़ती है। वैंकोमाइसिन नाम का एक ओरल एंटीबायोटिक होता है। माइल्ड केसेस में हम दूसरी दवाइयां दे सकते हैं, थोड़े मॉडरेट और सीवियर केसेस में ये ओरल वैंकोमाइसिन देना चाहिए। और ये निश्चित रूप से काफी ज्यादा मरीजों में अभी हम लोगों ने देखा है, इस हद तक कि एक पेशेंट को भी रिसेंटली हम लोगों ने रिकरेंट सी डिफिसिल के लिए फीकल माइक्रोबायोटा ट्रांसप्लांट करने की आवश्यकता तक पड़ी। ये इस तरह के हद तक जाने वाली चीज हो सकती है। सी डिफिसिल डायरिया एक सीवियर चीज है, तो एंटीबायोटिक्स का यूज जुडिशियसली करना बड़ा ही इंपॉर्टेंट है।
थैंक यू डॉक्टर साहब। डॉक्टर निशांत नागपाल, अल्कोहल की बात बहुत हुई आज, और पहले भी अक्सर होती है। अल्कोहल को एक विलेन के रूप में देखा जाता है मेडिकल वर्ल्ड में, जो है भी। अल्कोहल प्रेमी थोड़े नाराज भी होते हैं। ये बताइए डॉक्टर साहब, बहुत ज्यादा टी कॉफी लेने से और खास करके बेड टी लेने से भी क्या लिवर पे असर पड़ता है? अनम्यूट कर लीजिए डॉक्टर साहब।
सर, कॉफी का अगर आप डाटा देखेंगे तो प्लेन कॉफी इट हैज बीन फाउंड टू बी एंटी-फाइब्रोटिक फॉर लिवर. Without milk, if we take a black coffee, up to 5 cups of coffee has been found to be anti-fibrotic, that liver को healthy रखने में मदद करती है. Green tea with its antioxidants, plain coffee, they have been found to be good for liver, not bad. But जो अगर आप एक कॉफी ले रहे हैं जिसमें आप नॉर्मल तरीके से चीनी ले रहे हैं, नॉर्मल दूध ले रहे हैं, so then each cup of coffee, जैसे ये लेते हैं, I'll take it as an example here, if you take a milk वाली coffee like this, and then each cup is around 150 kilocalories. तो बेसिकली आप जो अपना खा रहे हैं, कॉफी ले रहे हैं, इसके अंदर कॉफी से ज्यादा आप अपनी कैलोरीज चीनी डाल के साथ में ले रहे हैं, और आपने 5 कप लिए तो 750 किलो कैलोरीज आपने अपनी एक दिन में जस्ट कॉफी से ले ली, कॉफी या टी से ले ली, जितनी आप पी रहे हैं. So you are not counting those calories, you are actually increasing yourself and pushing yourself towards NASH. But if you take a black coffee without sugar or a green tea without sugar, they are actually good for liver, not bad.
थैंक यू डॉक्टर साहब. डॉक्टर नितेश प्रताप, एक आखिरी सवाल आपसे.
जी सर.
अगर किसी को गैस्ट्राइटिस अटैक होता है और बहुत तेज अटैक होता है, तो इमीडिएट रेमेडी क्या है?
सर देखिए, जैसे डॉक्टर पीयूष ने बोला है और हमारे अदर पैनलिस्ट ने बोला है, गैस्ट्राइटिस एक ब्रॉड टर्म है. गैस्ट्राइटिस का मतलब होता है कि भाई नाभि के ऊपर के एरिया में आपको दर्द होना. मोस्ट ऑफ द पेशेंट्स नॉर्मली यहाँ जो दर्द होता है 3 कारण से होता है. अगर मैं ब्रॉडली देखूं, एक आता है वहां पेट, जिसको आप बोल रहे हैं गैस्ट्राइटिस, जो कि पेट में आपको सूजन, मतलब इट्स इन्फ्लेमेशन, लाल रेडनेस हो गई है पेट में जिसे. और दूसरा जो यहाँ दर्द आता है, जो सिवियर पेन जो आता है, ये एरिया में 3 कारण है जिससे मैं नॉर्मल कॉमन देखता हूँ. एक है अगर आपका गाल ब्लैडर का स्टोन का दर्द आता है, दूसरा आता है पेनक्रियास का, और तीसरा बहुत रेयर थोड़ों में आता है हार्ट का दर्द. तो अगर आप गैस्ट्राइटिस लेके चलें, नॉर्मली गैस्ट्राइटिस में ये होता है कि अगर मेरे पास जो पेशेंट कैसे आता है गैस्ट्राइटिस का, वो आता है भाई आपने खाना खाया, उसके बाद पेट में जलन होना, पेट का फूलना, डकारे आना, सीने में जलन, चेस्ट बर्निंग. तो ये मैं इनको एसिडिटी के लक्षण बोलूंगा. तो नॉर्मली जब ये ऐसे जो मेरे पास पेशेंट आते हैं, उनके इमीडिएट रेमेडी के लिए एक ग्रुप ऑफ मेडिकेशंस है जिसको हम बोलते हैं प्रोटॉन पंप इनहिबिटर्स. जैसे आपका पेंटोप्राजोल, रेबिप्राजोल, ये हम एसिडिटी की गोली देते हैं. और इंस्टेंट रिलीफ के लिए हम सिरप्स देते हैं, जैसे जो कॉमन अपना ब्रांड बहुत है, जैसे जेल्यूसिल एमपीएस, ऑल दीज टाइप, दीज आर द थिंग्स जो हम नॉर्मली ये पेशेंट्स को देते हैं गैस्ट्राइटिस के लिए. अगर आप दूसरा ग्रुप लें जिसमें बहुत सिवियर पेन हो रहा है, उसमें तो मैं रिकमेंड करूंगा कि अगर पेशेंट को बहुत सिवियर, ही शुड गो एंड मीट द डॉक्टर. बिकॉज जो गाल ब्लैडर का पेन होता है वो यूजुअली रात में आता है, बहुत सिवियर होता है. पेनक्रियास का पेन भी इज अ वेरी सीवियर पेन, जिसमें यूजुअली इन मोर कॉमन रहता है, जिसमें या तो गाल ब्लैडर में स्टोन है या वो पेशेंट में होता है जो क्रॉनिक अल्कोहल लेते हैं. ये 2 ग्रुप में बहुत सीवियर पेन आता है, इनको भी हॉस्पिटल को जाना चाहिए. मैं एक पॉइंट ऐड करना चाहूंगा जो आपने पूछा था कि भाई हाउ कैन यू डिफरेंशिएट बिटवीन कि हार्ट का पेन आ रहा है या पेट का पेन आ रहा है. नॉर्मली ये होता है सर कि जो एसिडिटी का पेन होता है, मोस्ट ऑफ द टाइम ये फूड से रिलेटेड होता है. रिसेंटली मैंने एक पेशेंट को देखा था जो मेरे पास आया था कि सर मेरे को एसिडिटी हो रही है, गैस्ट्राइटिस हो रही है. तो वो बोल रहा है कि हिज पेन उनको जब भी आता है जब वो वॉक करते हैं. पेन तो पेट में ही हो रहा है, पर चले जब होता है, ऐसे जब होता है, और जब रेस्ट करने से होता है, ये एक अलार्म सिम्टम है कि भाई ये गैस्ट्राइटिस नहीं है, ये हार्ट का है. तो अगर कोई पेशेंट को पेट में दर्द आ रहा है, जब वो चल रहा है और उसको रेस्ट लेने से आराम आता है, देन इट इज अ इंडिकेटर कि भाई दिस इज नॉट गैस्ट्राइटिस, बिकॉज गैस्ट्राइटिस का जो पेन है वो रिलेटेड टू फूड रहता है.
थैंक यू डॉक्टर साहब. ओवर टू यू मिस्टर शंकर.
Thank you, Kishore. And we'll just round up with this session with just one-liners from Dr. Nishant and Dr. Nitesh. We have a liver awareness month going on, which says love your liver. So what's your message to our viewers?
Sir, my message will be you are what you eat. This my grandma has been telling from time. And I think that is true. You are what you eat. If you can control your food, you can lose your weight, and that will prevent many of our diseases.
Dr. Nishant, I see you smiling. I think you're agreeing with what
I agree. And just like to add one line to it, just eat to live, not live to eat. Just is your motto. Just don't be foodie, just eat to live, not live to eat. You will be okay.
Thank you very much. I think now our viewers know what exactly to do when you have to love your liver this month, not only this month, in the coming months, also in this year, because we are going through a crucial phase of time. So take care of your liver, take care of your safety. And thank you very much for this wonderful session, all the panelists. Thank you. Thank you very much. We now move on to quiz number 2. Quiz number 2 is, which of the following helps ensure a healthy gut? A, consumption of a plant-based diet. B, regular intake of biotic or prebiotics. Eating a diverse range of foods. And D is all of these. The answers would be given at the end of the session. We now move on to another episode of, digital health has now been part of healthcare. It is now possible to monitor people remotely to prevent onset of diseases. In the following video by IHL, we give our viewers how digital technology can play a vital role in disease detection and management. We now play the IHL video. Topic is COVID and its effects on cardiovascular health, preventive strategies.
All the patients who have suffered from moderate to severe COVID, 80 to 90% have underlying heart damage. So they should also have a baseline evaluation of the heart. So let this new year be a new beginning when you are following the ABCDE approach. A is assess yourself every year. B is measure your blood pressure regularly. Very, very important. Check whether you are a hypertensive or not, or at least once in a year. And if you are a hypertensive, check it regularly. C is check your cholesterol. Check whether you are smoking or not. If you are smoking cigarette, give it away. Have your cholesterol levels in orders. And D is measure your diabetes status. Very, very important. And also take care of your diet. It is very important. Both diet and diabetes are very important. And E is exercise every day. Very important. The E is exercise and take care of your emotions and emotional health. Remember, disease is made of two words, dis plus ease. When easiness goes away from our mind first, then only you become diseased. A person does not become diseased by the body, but only the perception of the disease. When it starts in our mind, we start getting the manifestation of the disease.
So our individuals, where technology can play a role, in our sense, and that's why the India Health Link, we started with a simple mission. Can we educate our people to be able to understand what is bad, what is good? And more importantly, in healthcare, there is no one size fits all. The correlation of these factors, let's say we can say exercise is very good. Somebody can exercise every day, all day, but again, they might not be eating good food. Maybe they have other factors. Maybe they're not even fit for exercising all day, every day, because they're not supposed to. Now, how do we correlate these factors with somebody's health is where the technology can play a role. And technology can play a role by educating people and making them aware of their own self. Own self by simple things like Dr. Mohit was saying, have you done a checkup? Do you know what your blood pressure regularly is? Do you know what your other vital parameters are, or other lab factors like cholesterol? What is your body? How is your body reacting to these things? Based on that, how your lifestyle should be. Those two things actually where technology can play a role. And Dr. Srivastava, you are saying it right, that mobile sometimes is wrong because everybody relates that to a social media use of mobile all the time and the screen usage. But at the same time now, because of telemedicine, because of the phoning most of the people hand, they have access to those experts, that information that they can gain themselves. The only, again, where we are coming into picture is how can we bring them in a simple, accessible way that everybody can understand that. We are not bringing new information to individuals, but technology can play a role in that particular area, that the guidance of people to correlate what is right at the right time, at the right place. If nothing, what we are singularly trying to manage here through IHL Care program is we are trying to empower people with this information, with their health information, before it is too late. And just 3 pillars of our program, what we call IHL Care, what the 3 pillars of our program is, it's human-centered. So we build the system around people, and what we are giving them first-time access to what we call health account. Similar to how everybody has their email accounts or bank accounts, they should also have their health account. Because health account is theirs to keep, theirs to manage. They can enter the information, whatever they have on themselves, whether it's a blood report, doctor consultation, any kind of vitals data, whether they are using any watch, using anything on the phone, whatever they are using, whatever information they have on themselves, they can use that into their account. And their account is data powered, it's intelligent account, which can take the data and allow more than 50% of the population is hypertensive. And surprisingly enough to us, the stats at a corporate office as equivalent to in a tertiary care hospital where mostly patients are going. So this is what we are all talking about. Generationally and Indian culturally, we ignore the factors of hypertensive, obesity, diabetes, how they're making the long-term diseases more chronic. Why we are getting so many heart attacks, why the mortality is happening because of NCDs, just because we do not take care of ourselves when it is the right time. So going back to IHL Care mission is to empower everybody with the knowledge, education, the awareness before it is too late.
World tends to symbolize doctor care as the health care and the well-being of people have been limited by the provider system. India HealthLink offers the first ever connected user-centric healthcare ecosystem through its advanced digital platform and award-winning health station HPod. We have built an end-to-end wellness fabric to account for holistic care of everyone in the family. Here we look at the family of Neeraj, who lives with his wife Mona, parents and kids. Their housing society offered IHL Care Neighborhood, and they all signed up for IHL Care. Neeraj mostly travels for work, and on one of such trips he fell sick. He searched for a nearby HPod and found one at the pharmacy. He quickly checked his vitals including BP, temperature, ECG, oxygen saturation, and body mass composition in less than 5 minutes. Did a video consultation by sharing his health records and symptoms with the doctor, got the medication prescription, and collected medication from the pharmacy. He later shares his experience with his family. Mona, his wife, works at IT Private Limited. Her company has provided IHL Care Wellness to their employees. She gets a routine reminder to do her screening. She gets the health check done and schedules a diet counseling session from the IHL Marketplace. Later she finds the sponsored classes offered by her company on IHL app and enrolls for a yoga session to do along with her colleagues. IT Private Limited was able to improve the overall health index for their employees and are rated among the top employers to work for. Neeraj has a family view enabled on his IHL Care account and sees some concerning activity on his father's profile. He immediately schedules a blood check at home for his father and asks him to upload his prescription to get medicine delivered via IHL app partners. His parents are happy to have the convenience of IHL Care in their neighborhood. Daughter Tanya, while shopping at her favorite store in a nearby mall, gets an IHL Care coupon as a loyalty award. She gets a complete screening done to keep track of her health vitals. new kind of healthcare ecosystem is needed to cater to 1 billion plus people in India, so we built it. Your health is our mission, leading the charge for healthy India. One nation, one platform, equals IHL Care. Find the nearest HPod in your enterprise, housing society, hospital clinic, gym, yoga, Zumba, shopping mall, movie theater, railway station, and airports as well. Download the IHL Care app now to address all your healthcare needs.
We can operate on an X number of cases. My colleagues can put stents in maybe thousands, maybe lakhs, but the number of our patients is much, much more than that. So our stress has to be one, prevention, and two is if it happens to catch it early. And very easy to catch it if you have screenings or even self-screening. So that is, I think it is imperative. It is the need of the hour. I would also like to stress over here that quite a number of patients, mine and I'm sure equally in Delhi or Hyderabad, they will ignore their earlier symptoms.
You should know how to operate an automated defibrillator. Many times you see in airports when you go, the next time you go, you should pay attention. You have these red boxes on which it is written as AED. Now, those are known as automated defibrillators. So when the heart is beating like that, it's known as fibrillation. So the defibrillator gives a shock. That shock brings the heart back to normal rhythm. So these automated defibrillators are completely automatic machines. All you need to do is take that thing from the box, from that red box, follow the instructions, put the sticker on the person's chest, switch it on. It will analyze the rhythm and it will shock the rhythm if it is shockable, bringing the person back into consciousness. So these two things are life-saving. If you are not trained in CPR, you will have umpteen CPR programs in the city. And I feel even as doctors, as clinicians, we should start having more CPR programs for common people rather than just training our own fraternity, because any MBBS graduate, the majority of them at least, will know how to do an effective CPR. But what you need is every household should have one person at least trained in CPR. So in your own apartment complexes, in your own societies, in your own colonies, you should have more and more such CPR programs.
Welcome back. That was a glimpse of the digital future that we are going to face so that we take care of our health. We now have the answers to the two quiz that we had asked before. Quiz number 1, the question was, which of the following statements concerning yoga for gut is incorrect? The correct answer is performing yoga asanas just after meal can help in easier digestion of food. The answer to the second quiz, which was, which of the following helps ensure a healthy gut? And the answer is all of these. Those who have answered the question correctly will get a participation certificate. Now over to you, Kishore.
Thank you, Mr. Shankar. Thank you. तो आज के शो में इतना ही। मुझे पूरी उम्मीद है कि विशेषज्ञों के आज के विचारों से आपको फायदा होगा और आप इन बीमारियों से सफलतापूर्वक निपट पाएंगे और बचाव भी कर पाएंगे। अगले रविवार को हम फिर उपस्थित होंगे सुबह 8 बजे से और आपकी मुलाकात कराएंगे कुछ जाने माने विशेषज्ञों से जो आपको कोविड मैनेजमेंट और उससे जुड़ी सावधानियों के बारे में बताएंगे, खासकर उन लोगों के लिए जो दूसरी गंभीर बीमारियों यानी कोमॉर्बिडिटीज से भी पीड़ित हैं। तो आज के लिए आज्ञा दीजिए। नमस्कार, टेक केयर।